Good morning and welcome to the July 14th, 2020 Stanislaus County Board of Supervisors meeting. We will call this meeting to order. I do have a few announcements before we get started. Supervisor Tom Berryhill will be participating via telephone today. Good morning, Supervisor Berryhill. Are you with us?
I'm with you. Good morning.
Good morning. This meeting is open to the public, so welcome back, those of you who have decided to join us today. To provide for social distancing, as you see, the Chamber's audience seating capacity is limited to approximately 30 people. Consistent with guidance issued by the California Department of Public Health, face coverings are available to all members of the audience and participants in the meeting. Under the guidance, there are some exemptions for their use, and therefore the public may see some individuals during the meeting not using them. The option for verbal comments by telephone, as we've been doing over the last few months, is no longer offered since in-person attendance is now allowed. However, public comments submitted by email before the start of the meeting will be made part of the public record and distributed to the board members for our consideration. Please email your comment to the clerk of the board at cobsupport@stancounty.com and list either public comment period or the agenda item specific to what you're wanting to address in the subject line of the email. And finally, to watch the meeting, you have two options. You can observe it online, a live stream of the meeting at www.stancounty.com/sclive/, or board meetings are broadcast live on local cable television. In Modesto, it's Channel 7, Channel 96 in Oakdale, and on Channel 19 for the rest of the county. With that, we will begin this morning's meeting with a Pledge of Allegiance to the flag, followed by a moment of silence for former Stanislaus County Fire Warden Chief Russell Richards, and then an invocation from Pastor Lonnie Skiles of Big Valley Grace Community Church. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Again, we'll take a moment of silence for former Stanislaus County Fire Warden Chief Russell Richards. Thank you. Pastor Skiles.
Thank you for this opportunity. It's good to be able to be with you this morning. Just a few verses from Psalm 18 says, "The Lord is our rock. He's our fortress, our deliverer. He is our God, our rock in whom we take refuge, our shield and the horn of our salvation, and he is our stronghold. And we will call upon him who is worthy to be praised." Join me as we pray. Gracious Lord in heaven, creator of all that we see and know, you have made us, you hold us in your hands. We're grateful, Lord, for your good work in our lives, and we're grateful for the freedoms and the privileges that we have today to be able to meet like this, to be able to conduct business, to consider weighty issues. And Lord, we recognize that some of these things, many of these things that we're dealing with are far beyond our ability. And we ask for the wisdom that you gave to Solomon to discern the good things that would be of benefit to our community. I pray, Lord, for the board and the things that they carry in their lives, not only in their businesses, but also for their families, particularly with the virus that seems to be throughout our community. We ask for your protection. We ask for your blessing. And so, Lord, I pray for each of these homes, these families that are represented here today, that your peace would reign, that you would protect their homes, and that, Father, you would lead us like a shepherd. So direct our steps even here today. Would you give wisdom, discernment, so that, Lord, that many would be blessed and encouraged by the decisions that are made here today. So we surrender ourselves to you. We commit to you this morning, and we give you praise and thanksgiving in Jesus' name. Amen. God bless you.
Thank you. Okay, the next item in the agenda is the update related to the 2019 novel coronavirus emergency and essential services in Stanislaus County. Chief Executive Officer Jody Hayes.
Good morning, Chairwoman Olson and members of the board. My pleasure to begin again this meeting with an update on our emergency response to COVID-19. Joining me today is our Public Health Officer, Dr. Julie Weishenheim, and we appreciate Ryan helping Ryan Loop drive our metrics here. I'm going to provide an overview of some of the key metrics that we're observing in the emergency response. And once again, we're going to go right off of the actual county dashboard that's available to the public. And then once I'm done, I've invited Dr. Weishenheim here to help provide the board and the public an update on the actions that have occurred at the state and local level, particularly over the last 48, 72 hours. There's been a lot of activity. So Dr. V will help us through that. So we're going to start on the cases tab, and I'm looking to see if it's up. Okay, yeah, we are up. Okay, excellent. So a couple of things we want to point out. Number one, we want to acknowledge that we have completed the catch-up process of cases that were backlogged in our community. We first discussed this at last Tuesday's special meeting, and I want to acknowledge that it's been a difficult process to try to catch up with such a significant increase in cases here in Stanislaus County. We have implemented new procedures that will keep us more in line with the state dashboard that you see online. However, at any given point in time, depending upon when numbers are pulled and posted, you may see a slight discrepancy between those two numbers. They shouldn't be significant. However, there will be some kind of discrepancy during different times of the day between our two different dashboards. I do want to acknowledge on the cases chart, for those of you who are familiar with this, you'll know in the bottom left corner there, we have information by age group. And about 70% of our cases in Stanislaus County, as of yesterday's posting, are below the age of 50. That's a significant metric for us to be tracking as the impacts you can see at that lower level of the population. I also want to acknowledge that we have race and ethnicity on the very front page of our dashboard. And one of the numbers that we have tracked consistently for some time now with great concern is the impact of cases on our Hispanic and Latino population. You can see that although Hispanics and Latinos represent about 47% of our population, they represent about 73% of the cases in Stanislaus County. So definitely an area of concern and focus for us going forward. We'll go ahead and go to the hospitalization tab there, right? So I mentioned that we have 70% of our cases below age 50. That population represents about 32% of those that are in the hospital as well. So about 1 in 3 of our hospitalized COVID patients are under the age of 50 in Stanislaus County. As of yesterday, we were reporting 188 confirmed COVID-19 hospitalizations with 230 total when you add those that are suspected. And once again, suspected are those individuals that have COVID-like symptoms but are undergoing testing and we have not confirmed yet. We'll go ahead to the next tab. If we go to the deaths tab, I want to acknowledge that we had an uptick in last week where one day I think we reported 5 deaths in one day. There's a lot of background that goes into the reporting of these particular cases, and what we've learned in that process is that there is no strict requirement for the timing of when cases are reported to the local public health department. And so what that results in is you have a backlog of cases that may get reported to us all in a very short period of time, which is what actually occurred last week. It wasn't that we lost 5 people on the same day in Stanislaus County. It's just that we had other days where no one was reported because that information wasn't provided to our local public health department. And then once it was, we processed the information and reported it out to the community. There is a quality control process that goes through every one of these death reports in our community. It's very, very important that if we are reporting that somebody has died from COVID-19, that we have the appropriate confirmation from our public health officer, and she actually looks at these on an individual basis to confirm that that is the correct reporting. So I want to acknowledge that over time you're going to see days where nothing is reported, but there may be a death in the community that just hasn't come to our attention. So with that said, yesterday we asked for an update on what do we know as of today, and we actually know that there are a number that have just recently been reported to public health and that are undergoing that quality control process today. It's not a tremendous number. I'm not talking about, over 10 or anything like that, but I do want you to know, and don't be surprised if you see another day where we experience something like we did last week, where we have 5 deaths in one particular day. Kind of to level set expectations around deaths, when you research and you follow as many experts as possible, and I've tried to do this myself, and I'm fortunate to have the close guidance of a public health officer at my disposal that answers their phone 7 days per week. But when you research and follow these things very closely, most of the science around this concludes that the death rate for COVID-19 will be about 1%, somewhere in that category. Maybe a little less, maybe a little bit more than that. But that's the prevailing thought in the current scientific community. So with that said, you can expect that based on the number of positive cases that we have in our community, as well as the significant number of unreported positive cases, and that's really important. We've got a lot that are unreported because they have no symptoms and so forth. You can expect to have a proportional number over time. Another way to look at that is that on any given day, when we have 200 reported new cases in our community, you may expect that at some point that would result in 2 additional deaths in Stanislaus County. Just generally speaking, that's how the numbers trend. So the other thing I do want to point out before we click off of this slide is we do report deaths by race and ethnicity, so it's in the bottom right there. And although our Latino and Hispanic community has been 70% of our reported cases, their death rate is at 41%, which actually is below the population number of 47%. So that's a positive indicator. It doesn't absolve of our responsibility to do better with that community. And we'll be talking a little bit more about that today. Next. On the clusters, this slide is intended, or this data point is intended to help us understand where we have seen clusters of cases. This was particularly more important when we were dealing with outbreaks at the skilled nursing facilities. We have had a couple of significant outbreaks, but luckily for us, not as many as some other communities have experienced. That doesn't make it better. That's just a reflection on how we compare to others. Particularly the deaths by cluster category is very expensive, or very important to us as well. I will point out one data element on this chart that I think is a challenge for us. We have been trying to capture and report out where clusters have occurred by gathering events, and that's been very, very difficult. So although we only report 3% of our cases are by gathering event clusters, anecdotally, we believe that the number is actually much larger than that. So we're reevaluating whether this reporting, the way that it's shown today, is misleading or not. So I just want to call that out for the board and the community, that it's very difficult to confirm whether cases are coming from some of these gathering events. But with the level of spread in our local community and the obvious number of large gatherings that have occurred, we do believe that that number is higher. Next tab, right? So hospitalizations, for those of you who follow this very closely, this is the first tab that I look at every single day in our reporting to try to level set where we're at as a community. And kind of on the middle of the left side there are daily patients hospitalized confirmed for COVID-19 positive, and you can see we have about a 2-week trend there. If you take that trend back, I showed a slide last week where you could see at one point, which doesn't seem that long ago, we were down to 14 confirmed patients in Stanislaus County. Yesterday we went up to 188, and if you add in our suspected cases that are undergoing testing, we're at 230. I do want to acknowledge that many of those suspected will not test positive for COVID-19, but out of an abundance of caution based on symptoms, hospitals put them in that suspected category and so forth. But it is it's a very clear indicator when you look at how many positive individuals are under hospitalization, so they're having acute type symptoms and require that level of treatment. That is a data element that you really can't slice or look at any other way. That's how many people are in our local hospital system. I do want to acknowledge that not all of those individuals are Stanislaus County residents. However, as we've reported before, when we've looked at that data element closely, we had about 75% Stanislaus County residents. And most recently in our local calls with hospital administrators, we have learned that there is an increased flow of patients out of our community, which means Stanislaus County patients that are coming into the hospitals and actually being moved out to other communities right now. We do not have a current number as to how many of these patients are Stanislaus County residents or not. However, all the indicators from hospitals are that the vast majority of the patients are local patients. They're not being brought here from elsewhere. There are some rare exceptions, but I think that's important to point out. I also want to point out the ICU bed daily count. So on the right there, you can see that I think it's hard to see the data element there, but we have essentially hit what appears to be close to our peak for ICU bed daily count. And we are down to about 47 available beds in the ICU. This is a very fluid number. I think when we first started this process and I was learning, I perceived that that's a very hard number that's not going to change over time. And actually that's not true. Hospitals will convert certain beds to ICU beds going forward, so they have the ability to expand there. What I've also learned is that the majority, if not all of those open available beds would not be suitable for adults with COVID-19. They're actually going to be reserved for neonatal, intensive care, pediatrics, and so forth. So at this point in our community, our ICU beds are close to the max, and in some hospitals operating at maximum capacity. And what the hospitals have shared with us as late as yesterday, we did have another call with hospitals late yesterday with all of their emergency managers as well as hospital executives. What they did share with us is that their number one challenge to expanding the capacity for ICU beds is staffing. It is their ability to bring in nurses and practitioners that have the qualifications that are required to work in a critical care ICU environment. That is a specialty. Not all nurses qualify for that, and they are really struggling to bring in the level of staff that are necessary. With that said, they are working on it for sure every day. And we had specific reports from some hospitals of their efforts and plans that in the next few days, their ability to potentially expand that capacity or at least bring relief to their existing staff that have been working significant hours over the last couple of weeks. Go ahead, Ryan. Onto our testing page. I want to acknowledge just the subject of testing has emerged as one of the significant challenges for this entire emergency response, not just in Stanislaus County, but our entire state. I think I made similar comments last week. We were at the point in Stanislaus County where we had so many testing slots available to us, we couldn't get enough people to come in and test. And now we're at the point where it takes many days to get an appointment to go out and to get a test. It's not just us. We're hearing the same exact reports from other communities as well. Our emergency operations team is undergoing an analysis to determine what it is that we could possibly do within the existing system to try to drive more testing availability in Stanislaus County, not just availability, but a better turnaround time in Stanislaus County, and whether or not somehow we can operate differently within this system. These are all regional processes. These are large medical labs that conduct the testing, so it's very difficult to break out of that process and to do anything to scale. You can do it in very small doses where you can try to turn around testing quicker at a small clip, but to do it to scale over time is a much different challenge. And for now, we are much like the rest of the state in that we're struggling with testing turnaround. I saw some news reports yesterday, not in our area, but other areas that essentially acknowledged that if you're going to have a 5 to 7 day turnaround time for a test, that it effectively can make your contact tracing process almost null and void. And I know that's a pretty extreme statement, but the truth is that it greatly impacts the entire process. We depend upon a quick turnaround for testing. We depend upon it. And when that metric goes off, and when that bottleneck is created, particularly now at the lab level, it jeopardizes the entire process and strategy for us to effectively respond to the virus. Go ahead, Ryan. So this is our neighborhoods chart. We did have some feedback that we needed to change the colors on this chart, so I want to acknowledge our team that's worked hard to continue to improve the dashboard. And you can see that we continue to see a strong presence of cases by population in the South Modesto Ceres area, as well as the West Modesto area here in Stanislaus County. This has changed over time, and we'd like to get you some further data when we can that will actually show the changes over time, so we can measure our effectiveness in trying to tackle some of these very specific areas as well. I'm going to go ahead and then we're going to go to the next slide, county variance slide. So these are the 6 indicators that the state is monitoring for us. And I think most of us understand that we're on a state monitoring list. And when people ask, well, what does that mean? That means they're watching these 6 indicators. And then based on these 6 indicators, a county may be placed on a monitoring list. I think as of yesterday, I think there are over 30 counties that have been placed on that list. It's definitely the vast majority of counties in Stanislaus, or in the state. It's absolutely the vast majority of the population in California. One particular metric that I'd like to point out, if you go to hospitalizations in the top right there, and you click on the thing that'll increase it, there you go. There you go. Thank you, sir. This is a really important metric for us to all be tracking. If you look at this over time, you will see that we had about a 21-day stretch where our increased hospitalizations, so these are hospitalizations, a percentage change in COVID positive confirmed patients on a 3-day average. So it kind of takes out the peaks and the valleys, but it's tracking a 3-day average over time. And for about 3 straight weeks, we were over the state monitoring threshold of 10%. Those trends are not sustainable, and that's the challenge for our community. Those trends need to come down, and they need to stay down for a period of time. And I think that's what you're going to hear from a variety of public health officials. You'll certainly hear that from Dr. V in terms of what's available in Stanislaus County and what we're trying to accomplish. So if there are a couple of metrics that you want to pay really close attention to in our community as it relates to how we're progressing and how we can come off of the state monitoring list and how we can support our hospital systems, I think this is one of those key ones. Thank you, Ryan. So I want to acknowledge last week, this dashboard that I've taken you through is the most comprehensive dashboard that I've seen on any county's website in the state of California. And we're very proud of that. It's a good thing for us in the community. We've received a lot of community feedback with the type of data that they want and the type of data that we need to do our jobs as well. And we've always felt it was important to have the same level of information that we're working on, just have it available to the community. But I also want to acknowledge the challenge that presents to us as an organization to keep it completely up to date at all times and accurate. If we're not presenting accurate information, we're going to lose total credibility with the public and so forth. And we found ourselves in that situation last week. So I mention this because although we've been very quick to develop new features in the dashboard in the past, what we've learned is that all of those new features that we add, they slow us down as we go forward when we're trying to make changes and we're trying to keep up with the volume of case activity that's out there. And what's more important to us right now is to have timely, accurate information to the public. So I want you to know that this is the dashboard we have. It'll probably stay looking like this for some time until we can at least develop the systems and procedures in place that would be necessary for us to make additional changes without slowing down any of our reporting to the community. Last week was a difficult week when it came to reporting to the community because we had several days in a row where we knew we were out of sync with that state dashboard. And that's just not acceptable for us. We want it to be credible. We want the public to come here for their information, and we want them to know and trust that it's going to be accurate. So that's the latest on our metrics here in Stanislaus County. I'm going to go ahead and turn it over to Dr. Julie Weishenpiner, or Dr. V, for her latest update, as well as to take any questions from the board. And I do want to acknowledge that we don't have a specific PowerPoint this morning. I asked Dr. V, just please show up and describe what's happening right now. We can forego the formalities of PowerPoint because we're very busy trying to respond to the emergency. So it's all yours.
Thank you. Good morning, everyone, and thank you for having me here today. So Jody just gave a wonderful overview of this data dashboard, and I hope that you can see that we had a tremendous increase in cases in the past couple weeks. So one of the things to note is in the past 3 days, which is Saturday, Sunday, and Monday, we have actually had 544 cases reported. I mean, 544 in 3 days is getting to the level of uncontrolled spread, I do have to say. We know hospitalizations lag, so it's great to see that we actually kind of stabilized in our percent change of hospitalizations, but the number of people in the hospital is still way too high, and unfortunately, we're looking at more going into the hospital due to this high number of cases we're detecting. In addition to that, most estimates are that for every one case we identify, there are 10 that are not identified. Some people have said 20, but they've said a pretty firm figure now is 10. So that would actually mean that we had over 5,000 new cases over those last 3 days. So we are seeing a lot of disease spread, a lot of spread of this virus. And I think everyone knows that you're seeing it, and we have not yet turned the corner of trying to decrease, slow down transmission in our community in a level that we need to have it at to keep our healthcare system running strong and to be able to have various sectors open. So I think I don't need to talk about hospitalizations. If you looked at that chart when he was showing it, we went from 113 about 2 weeks ago to 188. And that's not a sustainable increase over the next couple weeks. And if we're seeing an increase in cases, it might be even a larger increase than that. So it's something to keep in mind about why we're trying to do everything we can to slow down transmission in our community. Talked something about deaths. I wanted to add on a little bit more that it's not, we're working very hard to make sure when we report a COVID death, it really is a COVID death. Sometimes people die of other things, and sometimes even though it's a month later, we will call this a COVID death if it's a chain of reactions that started with the first infection. So it really takes an individual review, which means pulling charts from hospitals, because usually they've been hospitalized. And it takes a little bit of time, like a day, depends on when we get the report and depends on when we get the medical records, but we review them as quickly as we can because we do want to be very transparent about our sharing of our data with the public, with everyone, and knowing and being very clear about what is real. So we're working very hard not to under-report, not to over-report, just to correctly report the deaths. So I asked Ryan to pull up this dashboard, and this is on the California Department of Public Health website, and it's the county data monitoring, where they show the chart of everybody being monitored and the numbers that got them there. And the reason I asked him to pull this up, if you go down to Port Imperial, just up a little bit. Port Imperial, sadly, is the hardest hit county right now. I think people have heard about that. And you can see their case rate, 464.4, I think that's per 100,000, and their test positivity is 20.5. Stanislaus County is second in the state for our high test percent positive and our high number of cases. So there we are at 394.3 for cases and 17.7. So if you go to the California Department of Public Health, you can see it, but basically we are the second worst state, or second worst county for spread in the state of California by these numbers. So our test positivity is high, our case rate per 100,000 is high, and we need to make a change in how we're doing things. Thank you. So anybody could go visit that and look at what all the other counties have, the counties around us, and everybody on the monitoring list, their numbers are put up there. So yesterday, as we look at what we can do to respond to this increase in spread in our community and protect our community, protect our hospital system, protect everyone, the governor and the state public health officer moved forward with more sector, as they call it, dimming the switch. So statewide, was ordered everything that we had already undergone. So it was trying to move everything outside. Last week I talked a bit about how you were 19 times less to be likely to be infected if you were outside than inside. So in an effort to move activities outside, restaurants, wineries, tasting rooms, movie theaters, family entertainment centers, zoos and museums, card rooms were all either you must operate outside or you must close down. I think a movie theater would have a hard time operating outside, so that would be a close. But all indoor services in those areas are closed. The bars, breweries, brew pubs, and pubs are closed unless they serve food, and then they're under the restaurant guidelines, so that it's outdoor only. So just if you think about where they're going, if they serve food, they're a restaurant, and it's outdoors only. So that went into effect statewide yesterday under statewide order. For the monitoring counties who are already having all those things in place, there were further movement of activities outside. So that's gyms and fitness centers, places of worship, indoor protests, so outdoor, fine again, offices for non-critical infrastructure, personal care, hair salons and barbershops, and malls. So it's a little confusing for some people. So the malls, what's closed, because I get that question a lot already, is the mall common area, the indoor area. Retail, so I mean, unfortunately, that's how you get to the store. So retail is open, and they can go back to the curbside, I would guess, unless they have an exterior door. So really awaiting guidance on a lot of these things, but I think that's what they have in mind. So those are the various sectors. The reasons behind it are here. Some of the other reasons are, as we said, we've been transferring some patients out of our hospitals to other counties. And so what affects one county ends up affecting many around you. And so trying to do it county by county or region by region is getting more difficult for the state, I think, because of this spillover from many counties. We have many people who work in other counties and are involved in outbreaks in other counties. So really, as a state, it's hard to really break us up into counties, I do have to say, because the virus doesn't stop at the county borders. It's spilling over from a county around it, and we're all needing to work to improve the spread. So lastly, the other large thing that happened yesterday is schools. And I think you've heard me say our number one goal has been to get kids in the classroom. We have been working very hard this summer. That is what we want. Kids need to be in school to learn. However, the spread right now has made it very difficult to provide a safer learning environment in the school with this degree of spread. It is going to be very difficult to keep the risk low enough to open up schools. What we are hoping is that this will only be a few weeks. If we can turn the tide now, schools weren't going to start for 3 or 4 weeks. It might only be a week, 2, 3, 4 of distance learning. We are working to get kids into class. As soon as we can close, decrease spread, and get our community back where we need to be, we will start getting our kids in the classroom. So hopefully it's going to be a very short time of distance learning, but unfortunately I can't predict how long it's going to take for us to turn this and decrease the spread. I hear a lot of people say, children are lower risk, which is true. Children seem to be, the younger you are, the better you do. It seems like those under 10, so elementary school is great, seem to get infected less, seem to spread less. I can't necessarily say the same for high school, so they're a little bit different. They're acting a little bit more like adults in their spread, a little higher risk, a little more spread. So the children in elementary are probably the least risk, but everybody is talking about the kids, but the problem is it's not just children in our school, correct? We have teachers, we have janitorial staff, we have bus drivers, we have office staff, and they are, many of them, at risk for severe disease. So while we need to get our kids in school, we need to do everything we can to be able to bring them into a safe learning environment and really keep the risk for spread as low as we can be. Nothing is zero risk right now. The virus is around, it's going to continue to spread, but we're working and doing everything we can to make it the lowest risk and the safest that we can. So really what the problem is, and then Jody talked a little bit about the testing. So our testing is also an issue with this. So since we cannot keep up with our mitigation strategies because a week after the test is back, most people are not infectious anymore. So what we're trying to do with isolation and keeping people from spreading, by the time we get a test result, it's past the time where they're pretty much done spreading. So it's in that sort of environment, it's very, very difficult for us to do contact tracing and really work to slow down spread. And that includes in schools. So it's really going to take everyone in this community really doing their part. And as I just talked so much about last week, it's really, this is primarily their droplet spread. If everyone stays at least 3 feet apart, if not 6, as we said last week, 3 feet lowered your odds ratio, or basically was 82% protective. So that's great. The further you can stay away, the better. You wear your face covering to keep those droplets from getting out for other people. And if we all do that, we will be able to get our kids back into school and learning where they need to be. So that's really all I wanted to say today. I think I covered all the activities of yesterday. So thank you.
Okay, thank you. Any questions or comments from the board?
If I could really quick, Dr. V, on the unicast and the cubic, how are we doing? Those are how we track groups and how much people are moving. How are we tracking on that now?
Right, I haven't seen the updates from this week. We have our last week that we had reviewed, and we were, it's really hard to interpret those. Many of the measures had kind of gone back to normal, although the density of exposures, it was still down. I would like to see this week, so we will probably preview them today or tomorrow before they're posted on the website. So I haven't seen them since last week, what's on the website.
Well, you've seen through the 4th of July, and on the through the 4th. I think we're up to the 8th.
Yeah, so we saw through the 4th, and it looked like it was lower, but part of this is people getting in their car and driving, right? So when you're not driving to work, it's highly influenced by that, because a lot of people in this county drive far for work, so when they have a long weekend, they tend to drive less far, so it actually tends to look better, even if people were all over and gathering together and having parties in houses. It'd be hard to detect based on those measures, I think. So we did see them last week. They are on our website with the new modeling. I mean, it did cover the 4th, but it looks like we did really well over the 4th. I'm not convinced, so we'll have to see how spread goes. It's not going well so far because, like I said, 544 cases in the last 3 days is a significant amount of spread.
And I had a text from someone that had a child that was sick, not a child, it's an adult child, and they were on their 12th day without any results from the testing. And when they sent me a text, so I think that's another problem. I know the governor says he's going to address that today in his comments, but I'm not sure exactly how to address it other than getting more tests. And I think there's a limiting factor there at this point in testing as well as tests. Have we had any problems getting tests, actual tests? So
there's pretty much, because the demand is so hugely high, there's pretty much barriers at all levels, but our sample collection is now pretty booked up for quite some time. And then when they go to the labs, those lab turnarounds are getting longer and longer, and some of that is reagents, some of that is staffing, some of that is just machines at their max. Most of the lab use is LabCorp and Quest, which are national labs, and so other states are also really increasing demand. If we were the only state, we'd probably be okay, but because there's many, many states with increase in testing demand, it's gone up. So everyone is working to increase their capacity in really all levels of this test. Remember, we used to be swabs. Actually, we're not out of swabs right now, at least not that I've last heard. So swabs is probably the one thing we have. But then every other, I would say, part of that whole testing process, from getting the sample all the way to reporting out the results, is slowed down. And it's bad. I mean, it's frustrating. We're all very frustrated by that. Yeah, it's.
Other comments or questions from the board? Supervisor Withrow.
Julie, thank you once again. I know you're working around the clock on this thing. Everybody is, and Jody, everybody, for all their work on this. Real quick on the testing thing that Jody, you kind of touched on there, and that we keep talking about here. I know the turnaround time of the testing is horrific, and we've got to fix that. My own brother got the virus it was 8 days into it before he found that out, and he had a runny nose and a headache for a day, and then he was fine. But again, it's not just our county. He's in San Joaquin County, and that's just, so I'm sure it's across the state that's going on. But if we can't get this testing thing, the tracing, contact tracing is, like you said, is a waste of time. I mean, if we get test results back 12 days later, then why do the contact tracing at that point? It's almost impossible, right? We're just chasing our tail on that, and I know we're spending millions of dollars on contact tracing. So if we can't fix this, if it's just beyond our capacity or beyond the state's capacity to do this, anyway, just to throw that out there for what that's worth. I'm not sure that we can.
If I could say something
Sure,
about
go ahead,
that.
Julie.
So some of it, I think, it does still have some value, not as much, but there is still some value. So you can at least still find people. So first of all, we can try to link to outbreaks. So we still talk to the person to try to find out. I mean, it's getting long at that point. You know, we'd like it sooner, but we still try to link for outbreaks, and then we can go in, especially if it's a congregate living center, and we can go find more cases. And we can still find the contacts. 12 days, they're probably already sick, but if they have symptoms, it's good for them to know that they were exposed and to go in right in and get testing. So it's I think better than nothing, but it's not the value it is when you get to them right away and you know, in the first day or two of illness. So yeah,
Okay.
very frustrating.
Yeah, it is very frustrating. So, and I know that it's nothing that we're doing everything we can here. I'm not saying anything that
Yeah.
we're not trying to do to make that better. The hospitalizations, do we know how many hospitalized are under 50? Do we have that stat? I didn't see that.
It was 32%.
Yeah,
I don't remember the number, but it was
Okay, oh, that's on the
32%.
graph there. That's right. So 32% then are
Yeah,
are under 50 at
about
this
1 in
point.
3 under 50.
Okay. Okay. And just the last thing that I'm just in the schools.
Yeah.
We talked about this yesterday in the meeting, and it's just so frustrating. And I don't understand that we keep talking about science. We have to go based on science. I get that, but when you see studies like this American Academy for Pediatrics come out with this report, and what they say and the language that they use, strongly advocates that all policy considerations for the coming school year should start with the goal of having students physically present in school. And I know
That was our goal.
that's everybody's goal, I know, but I just can't imagine the damage that we're gonna do here. And we say, well, let's just hope this is a few weeks, and the numbers, you know, the cases go down. I just don't see our cases going down. I could be wrong. Maybe all this additional efforts are gonna help the cases go down, but I just don't. And so if that continues on and these kids end up not in school, just the damage that's gonna happen there. And it always seems like it's the disadvantaged communities that are going to take the brunt of this damage. You know, the people that are blessed with the means are going to figure out a way to keep their kids, you know, tutors, whatever, private schools, even maybe send to private schools if they're going to be open. But probably at least 50% of our kids don't have the luxury of that option, and their parents don't have the luxury of that option. And so, just a statement more than anything. I know, you know, we're trying to do all we can, but this is just going to be detrimental to the kids, and especially in our disadvantaged communities. This is just going to be, I mean, not only in their learning, you know, the loss of learning that's going to happen there, but just physically, you know, their health. You know, they depend on the schools for their food. They depend on the schools for their nurses, right? Their, you know, their mental health, you know, that happens there. I mean, just everything. I'm not saying anything that not all of us have already discussed and talked about. But this is just devastating. And I hope that it's just 3 weeks, you know, that we're just delaying this 3 weeks. It's not the way this is played out. And we can try to blame it on, I guess, all the lack of social distancing and face mask and everything in our community. But I just think that this thing is going to continue on until it runs a course. And in the meantime, our kids are going to suffer dramatically because of this. So, anyway, I know you're doing all you can. Again, I'm never trying to beat you up or beat our staff up. I know we're all doing everything we can here, but I just think sometimes when weighing these risks, and right, that's what we talk about, right? Weighing the risk. Sometimes we got to take some risk. You know, sometimes you know we're going to have to make that decision. Okay, this is worth the risk for the sake of these kids, because the other side of this is going to be a greater risk. And so, anyway, just some tough decisions that have to be made. The easy thing is say, let's just keep the schools closed. I mean, I just really think that's an easier out. People probably won't agree with me. The harder thing is saying, no, we're going to open the schools and we're going to figure out a way that these kids can be in school and make this thing still work. We'll watch the cases amongst the school. We'll track it in there. We'll do all that kind of stuff. That's the tougher job to do, but I think that's the better decision to make here, the harder decision, but the better one. So anyway, for what that's worth, Julie, thanks for all you're doing.
Thank you, Supervisor. Supervisor DiMartini.
Yes, I just had a couple of questions. Are the schools you say are not going to be allowed to open, does that include the private schools? Are they free to do what they want?
So it was a joint decision with the superintendents and the health officer. It's not an order. So I'm hoping that they look at the data and make the decision that they feel is best for their students and teachers. But they are not ordered closed.
Okay, that's what I wondered, because that was just not clear to me. Once you get this coronavirus, can you, is that it for you then, or can you get it a second time?
Good question. Well, nobody knows because we've had it for 6 months. So, it probably, now you're asking me to just,
Oh, I thought
do
you
best
knew,
scientific
so-
guess. No. So right now, there is no evidence of reinfection. We have no evidence of reinfection. Will immunity be lifelong? Will the virus change enough to be like flu and you change? We don't know. We certainly don't expect reinfection anytime in, a short period of time, which might be up to a year. But it's just not known yet because the virus has only been around for 6 months. So we're really hoping it's lifelong immunity.
Because in other types of flu viruses, once you get it, that's kind of it, isn't it? And the virus
Yes.
goes away.
Yeah, the
6
virus
months
changes, which is why we get a flu shot every year. But you do get immunity to the virus, yes.
Is there going to be a flu vaccine this year?
Yes.
For there? 'Cause I always get one every year. I got one last year, and I got the flu a few weeks later. One of the worst I ever got it. I don't know how much value they have, but I do it anyway. Okay, I was just curious of that. You know that other countries have opened up their schools, so we're
Yes.
kind of running counter to what other countries think is safe and reasonable, but
Well, yes, but they've done it when their transmission wasn't quite this high. If we can get it down, we want in-person school, so I really think we can get it down. I do. I think that people can make the change and keep their distance and wear their face covering, and we can do the right thing and get transmission slowed down in this county enough to get our kids back in school. I do believe that.
okay. Thank you, Doctor.
Supervisor Berryhill, any question or comment?
No questions, Madam Chair.
Thank you. Just one follow-up question on the schools. I guess I'm just having a hard time understanding what do we think is going to be different on September 1st than August 10th? Because so far, since this all started, the numbers just keep getting higher, the community spread just keeps getting worse. So I just don't understand what data point we're looking at that gives us hope that something will be different on September 1st.
Right, so what I'm looking at is, first of all, when we had the stay-at-home order, we were on the way up and eventually we came down, right? So we came down and stopped our transmission, slowed our transmission in this community. When you look at other countries, when they take actions to stop people from gathering and being together, the numbers come down, the transmission slows down again. So we have taken a lot of actions, I would say, in the last couple weeks to slow transmission. It still takes people doing what they need to do, the distancing and the hand washing and the face covering. But I think I believe that if people do that, we will turn the curve again and we will bring it back down enough to get our kids in school. I really do.
Maybe I'm just not remembering things correctly, because that's very possible. When this all started, it seems like an eternity ago, but I don't think our numbers went down after the stay-at-home order. I think we only had 5 cases in the whole county.
Right. So we had 5 cases when it went in, and then from our cases, then they went up, and I think we peaked at like 30 or 40, I'm trying to remember, cases in the hospital, and then we came back down, and we were down at 10, 12.
Okay.
And we had brought the numbers down, so we'd gone up to maybe, 30 a day cases, and we brought it right back down to 5, and we stayed there
Okay.
for a month or so, maybe longer. So it works. And I think we can do it again. We just got a long ways to go this time because it's so much larger than it was before. So much more spread, so many people infected and spreading, yeah.
Okay. Okay, I'll leave it at that. Any other comments or questions? Okay, thank you very much. Moving on to the
I'm going to allow public comment. I think someone wants to comment.
do we,
I mean,
can we
comment
do that?
regarding this? Or wait till public comment?
I think we have to wait till public comment.
Good morning. We have one request for the public comment period.
Yeah, okay. So moving on to public comment period, before we invite members of the public in attendance up, I will let people watching online know who we've received email comments from, and you will receive a response from the county. We've received emailed comments, and all the board members have copies of them, from D. Laura Stokes, from Mr. Jim Bishop, from Miguel Donoso. And Mr. Donoso, we have received both of your comments on D3 and later on A1. And then also from Noe Paramo on A1, and Mike Garcia and Wendy Bird. So thank you all for those comments. We do have them, and we'll review them as a board, and you will receive a response. And then for in-person public comments, we will begin with John Mataka. Good morning, John.
Good morning. Can you hear me through this mask? Okay,
Yes.
good. John Mataka, 8505 Wilson Street in Grayson. I had to come in person to deliver this message due to the board suspending call-in comments via phone. To me, this is a dangerous precedent to do in lieu of most government and agencies doing Zoom and telephone meetings. The reason why I came is I want my comments to be heard by those watching today due to written comments being read into the minutes, but not into this meeting where the public can see them and view them on TV. Right now, there is a crisis in the Latino community, with 73% of the positive tests being Latinos. This means 3 out of every 4 positive cases are Latinos. There needs to be an action plan put in place immediately with verifiable outcomes that can be given in simple language to the Latino residents daily, Monday through Friday via Spanish TV, radio, and internet. Why has the board not declared a, quote, crisis in the Latino community? We've declared a pandemic, but why, with so many cases in the Latino community, has this board not declared a crisis in the Latino community? Well, I have my thoughts, and I'm going to share them briefly. That's because several of the board have made comments. One said they thought it was a conspiracy by China. Another one said the horse has left the barn and there's nothing we can do. Another one gave false information about hospital admissions. So we're not getting the same message from this board. Now, with that being said, I want to make some points. One, on outreach and education. I respect the Latino Emergency Council. I know a couple of the folks on there, but they're not the only go-to organization for Latinos in Stanislaus County. There are a lot more. There are doctors, there's teachers, there's community resource workers, there's activists. There's a lot of people in the Latino community that are respected and can get the message out very easily and that are active in the community. That's the point. We already heard about the testing. 1 week ago, I want to mention that the GI Forum is one of those groups. Let me backtrack. You know, they're veterans. Latino veterans of war. They know how to fight a war. Now, testing. 1 week ago, testing was offered at the United Community Center in Grayson. So what sites in the Latino communities are there currently? How many are there, and what are the hours? Are they evening? Are they free? Do you have to have symptoms in order to get tested? District 5, which has the most positive cases in the unincorporated area, it is the one that has the most symptoms in the unincorporated area. Mass distribution. Give them to community resource centers, to food distributors to pass out food at food banks, to field workers, to essential workers. Who's giving the field workers? This economy in Stanislaus County is an agricultural community. Several of the members on this board are farmers. Who's providing those masks to the agricultural workers that are doing the everyday work in the Latino community? We need to know that. We need to have daily, Monday through Friday, reports on the status of Latinos in Stanislaus County and the virus, and trends that need to be addressed. Hotspots need to be identified. The financial aspect. We need to know exactly how much of the $96 million is being spent on the issues in Latino communities and businesses. Saving millions in reserve account is affecting the war on the virus. Make no mistake, this is a war. Requests and plans to attack the virus have been documented and sent to the Board of Supervisors by Miguel Donoso, Mike Garcia, and Nori Paramo. It has taken a month in some cases to get a response, but no action. In closing, it doesn't help when public health is 1,000 cases off on the count of positive tests. I know there's a backlog, but that cannot happen. That just sends credibility down the road. Superintendent Kuykendall, I think that's how you pronounce it, Kuykendall, wants to open the school. It's time for everybody to work together. And if this issue was reversed, if this issue was 73% in the Caucasian community, I seriously doubt that we'd be having this conversation today. Thank you for your time.
Thank you, Mr. Mataka. Any other members of the public wishing to speak, please come forward.
Hey, John, could
yeah.
you just get us a list of the of some people who could do outreach for us? I'd love to get information. Yeah, if you could.
I'll send you an email.
Thank you.
Good morning. My name is Mary Jackson. I live in Turlock. I'm speaking today. I want to make it very clearly. You can hear me with my mask on. This is a doable procedure. Everyone is supposed to be wearing one. It's in the newspaper. It's on your agenda, and I'm frustrated. Mr. Chiesa has been very patient with me because I've called several times. I told him back on May 1st that if we did not go back to school, he would be educating my 2 6th graders, and they learned it's only 50%, not 70% of the day in Spanish. I've been using Google Translate since they started in kindergarten. So I'm going to read you my thoughts. Good morning. I come here today as a very tired, frustrated, and angry parent of 3 children. Yesterday it was announced the majority of public schools will not open next month. Today I've been up since 4 a.m., so you're going to hear my frustrations about why school is not going to open. As a local elected official, I used several core beliefs during my tenure. Either on the city council, I'm now a school board member, but again, I'm speaking to you as a parent. There are about 80,000 public school children, and they have at least 2 parents. So there's 160,000 of us in this county, I'm estimating. My core as a tenure as an elected official is to treat taxpayers' money as my own. You don't waste it. Hire good, smart people to do their job. Do not micromanage. And vote on what is best for the majority of people in your community, whether you agree with it or not. And this is the tenet that I'm talking to you about today. Those 3 principles are my political core. I know not everyone agrees with me, but that is the position from how I see government at every level to be successful. This is one of the many, maybe 5 days that I've gotten up since March 18th when I showered and dressed and got out of the house. But I am here, I'm wearing a face covering. Our kids were going to be spaced out. We had a plan, Mr. Withrow. We were ready to go. I spoke to my superintendent yesterday morning on my walk to make sure that we were going to open. And now we're not. So let's role play. I'm the teacher. You are my students. Your collective homework and assignment was to make sure your businesses are able to stay open safely, and our students would go back to class in August. Go back to class, not a hybrid, not distance learning, back to a regular school day with a tenured teacher. Why? Because my children's teacher did lie. They are not a joy to be in my class. Their parents cannot teach them. And you all failed. Do you understand? We are not going back. I talked to Mr. Chiesa back in May how important it was for them to go back. Parents are given choices. We have parents who don't want to go back. And that's okay. They can stay with doing distance learning. But the thing is, the schools we've learned through this process, they're not just a place to learn. Our kiddos, they love their teachers and their friends and the administrators, even the custodians they know by name, the lunch helpers, paraprofessionals, coaches, bus drivers, even substitutes like me. They miss each other. One thing I must remind you is that for some students, school is the safest place for them. It's not having them there 5 days a week. My biggest concern when we closed schools was to make sure they were not left alone and that they had food. Now, I rode our food truck in Turlock 2 days after we closed, and I saw 2 sets of sibling groups, 2, that chased the food truck down because they did not know how to feed their siblings. And I'm not making that up. I have a witness. We almost got hit. Don't tell anybody that. I shouldn't say that. Anyway, one thing I must remind, okay, so my college freshman, she graduated, I'm going to give you a story, but she's attending the Rochester Institute of Technology in August. RIT has been communicating and committed to reopening safely since the campus closed in March of this year. Many of the things RIT has done for safety measures has reassured me my daughter will be as safe as she can. This is what they've done. They rented out a hotel to become a dormitory for freshmen, able to spread out all the kids on campus. Mm-hmm. They're going to quarantine for 14 days before they start to arrive on August 12th. The semester was moved up 2 weeks, and they're going to finish on Thanksgiving, because I really believe that that's when we're going to have a second surge. I don't care. You all have passed high school biology. Viruses are not created in a lab, and there's going to be a second surge. They're mandating facial coverings, and what makes me feel better is the medical hub, so they have a lot of health care. They have 2 major hospitals, et cetera. The main reasons, and those are the main reasons why I'm comfortable. We also have a backup plan. Hold on, I'm going to keep talking. Sorry, you're going to have to suffer.
You're going to have to wrap it up in another.
Okay, so what I'm going to tell you is, I will wrap up, but I want you to know. When I was on the city council, it was during the Great Recession in 2009. There was a vote to whether to allow our poker room to increase. Because I have 2 examples I want to tell you. The number of tables. That's not something I personally agree with. I don't think it's right. But those 90 jobs were important to our economy at that time. Again, you guys, and again, I'm going to give you another example. In our district, every senior was allowed to walk on the stage. Okay, every senior was allowed to walk on the stage. They were given that chance to give in that recognition, which was rightly so. This is very frustrating. But then we had a group of 70 people, a group of athletics, and their parents, who went the night of graduation, probably spread some of this, and the police had to be called. Okay, all of you wear a seatbelt and have car insurance, correct? Sorry, and you're blurry you're so blurry.
And I'm sorry, Ms. Jackson, but we do really need
to
wrap it up.
What I'm telling you is you need to start leading. Do whatever it takes to get us so we can start school the day after Labor Day, because I'm going to be back here on that Tuesday. Hopefully my children will be in school, or Mr. Chiesa will bring them with him because he's going to be teaching them. Right?
You've been very consistent about me teaching your kids. And if you know her twins, she's got 2 wonderful kids.
Yes.
And if I had time, I would love to teach them.
Yes.
They wouldn't learn anything from me. But
Well, what you just said is not happening in my classroom as well. So what I'm telling you is I'm urging you. We have plans in place. We are ready to go. The safest, best place for children is in school. So that means you're all wearing a mask. You're all wearing a mask. I mean, I've said that. I've told parents that. If you want to be your own child's teacher, then you keep them at home. But if you want them in a classroom, it's not protecting them. It's protecting everybody else. Thank you,
Ms. Jackson. Appreciate your time. I do want to clarify, just so there's not misunderstanding in the public, this was not a county decision. This decision was a decision made by school superintendents. And I'm fairly certain, you should check with your school superintendent, but I'm fairly certain that school boards have the ability to make that decision. I know they have in other counties, but this was not a county decision. It was made by school superintendents.
But as Dr. V said, it's because of these numbers. So we have 6 weeks to get them down.
Right.
That's what I'm asking you to do. I drove by downtown Turlock, as I told Mr. Chiesa yesterday. And actually, I called. There were 3 businesses, no masks, no social distancing. I want to support every local business I can, but when you do things like that and there's no repercussions, when you have your sheriff say some of the comments he said, it's not helping, it's hurting. So my point is, get on this bus. The train has left the station, Mr. Withrow, but the problem is we're derailing right now. And you're taking 80,000 kids with you. And I'm the angry parent, because 2 of mine aren't going. My oldest is, and I think Mr. Makata said something that's very important. In our meetings, we read public comments. I would encourage you to do that.
Thank you. Okay, moving on. Oh, are there other members of the public wishing to offer public comment? Okay, seeing none, we will move on to the consent calendar. We have a request from the board to pull item B13. Any other requests from the board to remove an item from the consent calendar? All right, do we have any members of the public who've asked to have an item from the consent calendar removed?
We do not.
Okay, great, thank you. Then do I have a motion to approve all items other than B13?
Motion to approve, minus B13.
Second.
All right, we have a motion and a second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
I think I heard an aye. Supervisor Berryhill? Yes, thank you.
Aye.
District 5 Supervisor DeMartini.
Aye.
And District 1 Chairwoman Olson.
Aye, motion passes. Item B13. Read that off. Approval to execute a Public Works of Improvement Agreement to Division 5-15 Inc. of Gold River, California for the Stanislaus Building HVAC Replacement Project.
Okay, thank you,
Supervisor
Chairwoman
DeMartini.
Olson. I pulled this item just to make a comment on it. It's not that I believe that the building doesn't need a new HVAC unit. What I want to point out is this building was built in 1998, and the county has just not put any kind of capital reserve in to take care of these problems as they come up, and we know that they are. This particular building that we have jointly with the city of Modesto does have the capital reserve, and money is put in every year because we know that the HVACs are going to go out, or we're going to have plumbing problems or electrical things that need to be repaired. And I just think that just as a future, we should really think about at least in general fund departments, that a little bit is put into the building maintenance as just part of the budget. This particular item is $1.8 million. Yeah, I'm not saying that that's too much or that it's not needed, but had we started back 22 years ago, just putting up a little bit into the fund, the general fund isn't going to get walloped like this. This all comes out of the general fund balance, and I think there's a better way of doing it, just like it is for this building. And just also mention, that like for instance, the animal shelter, and I could just see the train wreck coming on this one here. We have 5 partners that are really not very well financed, and there's like zero money in building maintenance in that building. And when something happens to that, I don't know where the money is going to come from on it, but it's the county can't pay for it all. At least it shouldn't. But just something that we ought to think about is just putting some money in every year for building maintenance for all these buildings we have, because sometimes these costs are tremendous. We had social services building was $10 million one year to replace the HVAC units. We had substantial cost in the jails one time to fix a boiler. So that's my only comment. I intend to support this today. I'm not saying it's not needed, but I just think that we ought to be really in the future thinking about putting a reserve in for these buildings, for these costs that we know are gonna happen.
Is that direction for staff?
Well, it's a comment. I really think, I think especially the animal shelter, you really ought to be
I think
thinking
that's
about
a
that one.
wise thought.
Yeah, we do it
Supervisor.
for this building too. It's just that some buildings we don't. I know general fund departments really don't have much money, but other ones have revenue. And it's just my thought when I see $1.8 million coming out of the general fund, with no planning at all, knowing that this is going to happen, I just think that something should change in the future.
Thank you, Supervisor. CEO Hayes.
Thank you very much. And I want to thank Supervisor DiMartini for bringing this to our attention, not just in today's meeting, but also in some prior conversations as well. We do have a variety of planning efforts around the maintenance and the ongoing care for our county buildings and infrastructure. So I do think it'll be important for us to describe what that process looks like and where we feel that we can improve that process based on the information that's been shared with us. Thank you.
Great, thank you. Any additional comments on this item? Any members of the public wishing to comment on this item? Any email comments on this item that we haven't yet received?
No.
Okay, thank you. Do we have a motion?
Yeah, I'll move to approve the 4 staff recommendations.
We have a motion from Supervisor DiMartini, a second from Supervisor Berryhill. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
Aye.
District 5 Supervisor DiMartini.
Aye.
And District 1 Chairwoman Olson.
Aye. Motion passes. Moving on to our public hearings, item 7.1. Public hearing to introduce and waive the first reading of an ordinance to establish new fees and amend or eliminate existing fees for the Department of Environmental Resources. Jamie Agers.
Good morning, Chairwoman Olson, board members, CEO Hayes, and County Council Bose. Jamie Agers, Director of Environmental Resources. And while we're bringing up our item, I wanted to introduce Julie Mendoza here joining me at the table. Julie is our Special Projects Manager in the department, and she helps us every year when we review our fees. So as soon as we get it on the screen here, we'll get started. There we go.
That's fine.
So we've already introduced this item, which is to consider annual adjustments to our fee structure. And the divisions that we'll be talking about today with some fee adjustments include our Hazardous Materials Division. CUPA stands for the California Unified Program Agency. Our Environmental Health Division, our Milk and Dairy Division, as well as the Landfill Division, and then we also are recommending an adjustment to our department weighted labor rates. So the proposals today include modifications to some new and many of our existing fees. And these are due to needing to recover program costs and, in one case, a consumer price index change. So starting with our Environmental Health Division, we are proposing some changes to our food programs. One is adding a new fee for host facility. A host facility is something new that the statute is now allowing, and these are wineries and breweries, which unfortunately just closed again. But these are facilities that we normally do not have under permit because they are not what we consider food facilities. But there's more and more demand as time goes on for these types of facilities to serve food. So they have an ability now to become a host facility where they can bring in food from a permitted restaurant or even a food vehicle, that sort of thing. So we're recommending to add a host facility fee. And then we're recommending to add a new fee under our land use program, which is a site evaluation / consultation fee. So starting with our amended fees, our weighted labor rate is something we recalculate every year, and some costs have increased, so we're proposing, it's about Well, a $4 per hour increase, and I wanted to share with you that this one last increased back in 2018 and was adjusted then by about 3%. And then with respect to our clerical weighted labor rate, it's been many, many years since we have proposed adjusting this one. It's rarely used, but in recalculating this year, it changed a bit, so we are recommending increasing that to $47 per hour. Moving on to our hazardous materials fees. First, in our underground storage tank program, we're recommending a 15% increase. That is the same increase that you approved last year. And in our generator program, we're recommending the same increase. This one, however, has not been adjusted since 2008, so 12 years. And you'll see several fees in our discussion today that haven't changed in many years. And last, we're recommending that we take a category we refer to as a justified complaint fee, and it's kind of common throughout our fee structure, so we're recommending to move it out of the individual division fee categories and moving it to a miscellaneous fee section because it applies to many programs. Then moving on to environmental health for amended fees. We're pretty much recommending a fee increase to our food categories across the board. So that's categories 1, 2, and 3, in addition to our temporary and mobile food facility fees. And we're recommending a 5% increase, which is the same increase you approved last year. However, last year was the first increase since 2008. On our cottage food operations, those were a new fee category that came about by statutory change. That was added in 2013. And so this is the first adjustment to this category, and we're recommending a 10% increase. Also, with respect to cottage food operations, we have to review and approve their menus. We're recommending just modifying the category a bit to read menu review / modification, but also to benchmark it with a 1/2 hour minimum of our weighted labor rate instead of specifying the actual dollar amount. Continuing on with environmental health, we have discovered that our historic fees for folks that are found to be operating without a permit are really not in line with statute. So we're recommending changing them to double fee plus the permit fee. And what we found was in some cases with our past fees, we were undercharging. In other cases, we were overcharging. And again, not consistent with statute. So we're recommending double fee plus the permit fee. Moving on to body art program, which unfortunately these facilities have been closed now for quite some time. This was a new program added in 2013, so no change in the fee structure since that time. We are recommending a 10% increase, but I will share with you that we have delayed our billing to these facilities, and we'll be hoping that they're able to reopen soon, but we will be very accommodating in prorating fees and waiving any late fees and that sort of thing. In recreational health, which is your public pools and spas, we are recommending a 10% increase. And this is another category where the fees have not changed since 2008. With respect to recreational health plan check and over-the-counter clearance fees, we're recommending a category change to private pool land use clearance / over-the-counter. And again, benchmarking it to a 1/2 hour weighted labor rate rather than specifying the dollar amount, so that whenever the weighted labor rate changes, it won't affect the category. And continuing on with environmental health, in our public water system program that we administer for the state, we're recommending a 10% increase, which is the same as you approved last year. In our septic pumper truck fees, we're recommending a 15% increase, and those have not changed since 2008 as well. Also in the septic pumper truck, for additional truck fees, we're recommending a category change as well as a fee change. And we're recommending changing it to additional septic pumper truck / concurrent inspection with the first truck, and increasing the fee from $67 each, which was a 50% discount for the multiple trucks, and lowering that to a 25% discount to $115 per additional vehicle. And continuing on with our environmental health fees, we're recommending to eliminate one fee category, which is sewage treatment operation permit fee. We no longer do this in the department, and so we're recommending eliminating that fee category. In our liquid waste program, which is your septic inspections, we're recommending a 5% increase, and that was last adjusted last year when you approved a 10% increase. In our land use program, we're recommending a 15% increase. This is another fee category that has not changed since 2008. Another type of land use fee we have is a subdivision or project road improvement plan fee. And we're recommending, again, to benchmark that with a 1/2 hour weighted labor rate minimum rather than specifying the fee. And the same for building permit review fee. To wrap up our environmental health fees, we have a category we refer to as administrative fees. Again, we're recommending benchmarking that with a 1/2 hour weighted labor rate. This one was last adjusted in 2008. We have one more elimination that we're recommending, and that is for a vehicle sticker replacement fee. We're finding that way too many of these mysteriously disappear, and they could reappear on another vehicle somewhere. So rather than be reissuing these stickers, we're just going to stop doing that, or recommending to stop doing that, because they always have paperwork that we give them as well that they can keep on the vehicle to prove that they actually have a permit. And two others, after hours inspection fee, again, we're recommending to increase from just the straight weighted labor rate there to a 2-hour minimum weighted labor rate. And here's that justified complaint fee category again that we're recommending to move under administrative fees. And moving on to our milk and dairy program, we last adjusted fees here in this category in 2017, and that increase was a little over 9%. So we're recommending two things today, an 8% fee increase to those fees, and we're also recommending to benchmark the grade B dairies together with grade A, which is a change, but it's a change consistent with what's happening elsewhere in the state. The requirements for grade B dairies used to be somewhat lower than grade A, but that's all changing, and everything's being levelized, and the requirements are becoming the same across the board. And our last category today is with respect to our landfill operation. First recommendation is to add clarification to what currently is limited to refrigerators and freezers. We're recommending adding water coolers and water dispensers to that particular category. And then all of our general waste categories, which includes price by load, just normal refuse, in addition to special handling and hard to handle waste, we're recommending between 8 and 10% increase to those categories. And you last adjusted these last year at approximately the same amount, around 9% across the board. And last, but certainly not least, each year we are obligated to adjust the tipping fee for ash that comes from the waste energy facility. It's benchmarked with CPI, and this year we're recommending a 3% increase. So moving on to the work we do behind the scenes, consistent with adjusting our fees each year in either June or July, we held public stakeholder meetings back in March, and overall the feedback of the participants was favorable to what we were proposing. But as you know, we've delayed the processes 2 months because of all of the COVID activities. Public notices for the workshops were printed in the Modesto Bee, and they were also posted on the department's website. So the staff recommendation today is to introduce and waive the first reading of an ordinance to establish new and amend or eliminate existing fees for the Department of Environmental Resources. I'd be happy to answer any questions you may have.
Thank you, Ms. Eggers. Before I ask if my colleagues have questions, one overall question, and you may have addressed it at the beginning of the presentation, but I missed it. I'm curious, what has caused the increase in the overall weighted labor rate? Is that based on inflation? Is that...
Those are our administrative overhead costs, but they do reflect some of the increases in salaries and benefits and so on. Mm-hmm.
Okay, thank you. Questions from the board? Supervisor Withrow?
Yeah, no questions, just comments. Jamie, Julie, thank you guys for doing this. I know this is a monotonous process, but there is a method to your madness as far as how this works, and we always say it every time we go over. Remember back when fees was like a big deal and something we were really worried about back when we used to have meetings, and this was like a big item during the meeting. We've got a few other things going on right now, but anyway, we know that this is just based on cost, and all our fees in the county is really just based on trying to cover our costs. So we always mention that every time. I'll mention that again. So thank you guys very much for doing this.
Thank you, Supervisor.
Supervisor DeMartini.
I know the fee increases are necessary from time to time to recover our costs, and these increases seem reasonable. I just wanted to go back, though, into the one that you called body art. I assume that's tattoo parlors?
That's correct.
Yeah, I figured that's what that was. You know, these, as you mentioned there, and I just wanted to be sure I understood it right, that these companies that have not been able to operate for the last few months are really in financial distress. And this is one industry, and then, I mean, there's other ones that you don't regulate, like hair salons and nail salons. And so, they want to go back to work, and every time they get ready to say, well, we're going to open up, you know, then the governor comes out with some edict that's, you know, usually not based on any science at all, just whatever the emperor decrees. So for these companies that are not able to open and generate income, you're allowing them time to pay this? I mean, you're not pulling their license or anything for
No.
these?
That's correct. We're allowing them time. We're allowing them to defer. If they do pay and they want to request a prorate, we're happy to do that. Late fees will be waived, and we'll work with them however we can, since they have been significantly impacted by all of this.
Yeah, I just wanted to be sure, because I think that's appropriate, because these businesses have been shut down to no fault of their own.
Correct.
And they've been unable to pay the rent for their buildings, or they're all unemployed, and I think the county has to take into consideration that you know, they'll pay when they open back up.
Absolutely.
And there'll be no late charges or anything for companies like this?
That's correct.
Okay, I just wanted to be sure, because I think that's fair to do that.
Thank you, Supervisor. I do have a question from Supervisor Berryhill, and that will lead into my questions and comments as well. So Supervisor Berryhill is asking, is this the time to raise rates when so many of our businesses are not able to open or operate where they can make a profit or pay their bills? Should we wait until after the COVID pandemic has allowed these businesses to return to normal business practices?
That's a very good question. Unfortunately, we're not covering our costs in some of our program areas, and that's why we had developed the recommendations that we did, which under normal circumstances would have taken place a couple months ago. So again, we're happy to work with businesses that have been impacted to the best of our ability, but in some cases we do need to consider adjustments.
Thank you. CEO Hayes.
And if I could just add to that, thank you. I think that was a very, very good response. But I also want to add that the rate increases that are coming before you, this is just one of many. We have strategically looked at from a county budgeting perspective to try to delay, and there has been some delay in the process, but we felt that they all would need to come forward, that this would be an appropriate time without further delay. I would just add that if there was a delay in any particular one, that we just consider delaying more as well. But we would have to provide a more comprehensive budget impact to the board on what all those actions are.
Thank you, CEO. Before we go out for public comment, I will make a comment. Perhaps something in public comment or board discussion will change my mind, but I can't support this today. These fee increases being proposed, some of them, there was another 10% increase last year for some of them. Our salaries and benefits haven't increased 10% that I'm aware of in 1 year. And most of the fees being increased are specific to restaurants or body art businesses that are suffering the most in our community right now. So I can't support this item. Is there any member of the public wishing to offer comment on this item? Seeing none, I'll bring it back to the board for further discussion or a motion.
Motion to approve.
I will second that.
Okay, we have a motion and a second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
No.
District 5 Supervisor DeMartini.
Aye.
And District 1 Supervisor Olson.
No. Motion passes 3-2. Thank you.
Thank
Moving
you.
on to public hearing 7-2.
How did Barry Hill vote on that?
No.
Oh, did he? Okay.
A public hearing to introduce and waive the first reading of an ordinance to establish new fees and amend existing fees for building services. Planning and Community Development. Looks like we have Angela Freitas instead of Denny Ferreira.
Good morning.
Oh, I see Denny. Hi, Denny.
Good morning, Chairwoman Olson, members of the board, Mr. Hayes, Mr. Bose. I'm Angela Freitas, the county's planning director. With me this morning to present this item is our business manager, Sam Groves, and with us is our chief building official, Danny Ferreira. Just give it a sec here to get the presentation up and going. So Building Permit Services oversees the administration of building permits for the unincorporated area, including the enforcement of abandoned and dangerous buildings. The staff oversees the county's one-stop shop permitting process, which is a partnership between Planning, Public Works, the Fire Warden, and Environmental Services. And they also do the calculation and collection for the county's public facility fees. Building Permit Services is 100% funded by fees, with 90% of those fees being valuation-based and 10% being flat rate fees. The last comprehensive update to the Building Permit Services fees was adopted in 2010. Over the last 10 years, the department has been able to avoid a fee update through a mix of lower staffing costs, implementation of process improvements, and the growth in high valuation permits. The proposed fee increases reflected this morning are an increase in salary amounts, healthcare costs, and general operation costs that can no longer be sustained under the existing fee structure without the use of fund balance. The fees being proposed this morning are derived from an in-house fee study and reflect an average increase of 18%. This increase is consistent with the 17.9% increase in the Consumer Price Index from January of 2010 to March of 2020. One change that has occurred since the 2010 update is that the Building Permit Services now contributes its fair share cost to the department's general administration, including finance and human resource staffing. Again, 90% of the Building Permit Services fees are valuation-based. Valuation-based fees are calculated using the construction cost times a permit fee multiplier. The multiplier is based on the percentage of the budget expected to be provided by the building permit revenue. The value of construction used in determining the fee is based on building valuation data, BVD, published every 6 months by the International Code Council. The data is based on market value averages of construction costs throughout the United States. The department currently uses the February 2010 BVD, which was the latest published BVD at the time of the 2010 update. The department is proposing to use the February 2018 BVD. Based on a survey of contractor reported valuations over the last year that have come into our department, the department believes that the February 2018 BVD is reflective of the local market conditions. The department is not proposing any change to the multiplier value used to determine the fee, and the 2018 fee just want a point notification, the 2010 fee update authorized the county's building official to use the most current BVD. However, the BVD has never been adjusted as the fees being collected were adequate to cover the costs. As reflected in our request, we are asking again for the 2018 BVD because the department does not feel it necessary to always use the most current BVD and will continue in any future updates to look at the BVD to make sure that we are hitting the local needs to meet our fee needs. So attachment 2 of your Board of Supervisors report provides a comparison of the county's current and proposed valuation amounts along with the current and proposed fee amounts for common construction and permit types. And in that attachment, there is also a comparison of the fee amounts with the counties of Fresno, Sacramento, San Joaquin, and Tulare, along with the cities of Ceres, Houston, Modesto, Oakdale, and Waterford. The slide before you now reflects the table in your board report comparing the existing and proposed fees. As mentioned earlier, the average fee increase is 18%. The highest dollar fee increase is $770 for a single-family dwelling, and that would be based on a 3,300 square foot dwelling with a 1,350 square foot garage and 740 square foot patio for a total permit cost of $5,052.55. The lowest fee increase is $26 for a water heater replacement for a total cost of $126.28. While not reflected in this slide, the plan check and field inspection per hour fee is proposed to increase from $85 to $98 based on the weighted labor rate for the mid-range of the staffing classification assigned to that position. The county's proposed fees are neither the highest or the lowest when compared to other counties or cities, as shown in the slide before you and in the table in your report. Variations in the fees among the various jurisdictions can be the result of many factors, including but not limited to if a jurisdiction's fees are based on the actual cost of providing services and the staffing levels, salary levels, and indirect overhead costs associated with operations necessary for service deliveries. As mentioned earlier, the county's building services is 100% funded by fees. They receive no general fund dollars. The department is proposing the addition of 3 new building permit services fees. Those include a 3.5% credit card processing fee that would be applied to any fee collected by credit card to cover bank service charges and/or merchant fees. Actual fees charged to the county vary based on the type of credit card that is used. The 3.5% is a 5-year average charge to the department for online permit payments. The option for customers to continue to pay by cash and check will remain, so customers are able to do business with us without using a credit card. The second new fee being proposed is a one-stop shop payment collection fee. It's a flat rate of $5 to cover the administration costs of collecting and transferring fees collected for other departments, fire districts, and the state. The one-stop shop fee collection reduces the burden on customers and entities charging the fee by centralizing the process. This fee would be charged on a per permit application basis. The third new fee being proposed is an address fee to cover the costs of issuance of new address, reassignment of addresses, and address research. Currently, there is no fee associated with addressing. The proposed actual cost recovery would be based on a $98 per hour fee. For new addresses, it would be a 1 hour minimum deposit, and for reassignment and research, it would be a half-hour minimum deposit. Notice of the proposed new fees and amendments to the existing fees was provided to our regular representatives and applicants seeking building services. There were about 50 on the list, along with the county's Farm Bureau and the California Building Industry Association, the BIA. We have only received one comment, and that was from the BIA that found the fees to be reasonable. Staff is recommending this morning that the board conduct a public hearing to introduce and waive the first reading of an ordinance to establish new fees and amend existing fees for building services. If these fees are approved, they would become effective September 26th of this year. That concludes my report, and with that, staff is available for any questions.
Thank you. Appreciate the presentation. And just so my colleagues know, I do feel differently about this issue. You know, construction was named an essential service from day one throughout the coronavirus. We're not seeing dips in the housing market in Stanislaus County at this time. So this does seem appropriate. Prior to March, we were on track to have our best economic year later, and everything fell through the bottom in March. But hopefully, construction and housing remain stable, because that's what we're seeing so far. Any comments or questions from the board?
I was just curious on this credit card fee. Are there very many people who use credit cards for building fees? Is this fairly rare, or is it common?
It has picked up in the last couple of months, partially because we were closed to the public, so people were submitting permits online, which increased our credit card volume. So we saw our fees increase quite a bit during that time.
Yeah. So if I may just add to that, so prior to COVID-19 hitting, and I want to give credit to this gentleman over here, Denny Ferreira, he had really gotten us online for building permits, and we were doing about 30%, and when COVID hit, we were able to switch over to 100% of building permits online. So we did have a significant trending of online permits, and with COVID, we are seeing a lot more online permits. And some people choose to still come in. We're operating by appointment, so people can come in, they can drop off checks, they can make an appointment, they can still pay by cash or check, but there has been an increase with folks just wanting to pay online.
Okay, well, as long as they're not forced to use a credit card, I would be okay with it. I certainly would resent having to pay it.
No, we have tried to stay very flexible. We have a drop-off box. We will meet people down in the lobby. We will offer them many other ways of paying, so they do not have to pay by credit card.
Okay, well, as long as nobody's forced to use a credit card, I'd be okay with it. I realize you're just covering your costs, so it's just something we do need to do.
Seeing no other comments, great customer service, by the way, by providing both options. Thank you for that. Do we have any comments from the public on this item?
We do not.
Seeing none, I will bring it back to the board for a motion.
Motion to approve all staff recommendations.
And second.
We have a motion and a second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
Aye.
District 5 Supervisor DeMartini.
Aye.
And District 1 Supervisor Chairwoman Olson.
Aye. Motion passes. Moving on to item 7.3, public hearing to introduce and waive the first reading of an ordinance to establish a new and amend existing fees for planning services. Angela Freitas.
So as many of the board members may recall, back in May of 2018, the Board of Supervisors approved a user's fee study prepared by Matrix Consulting for planning services. The user's fee study included a total cost analysis of all planning services fees and provided a comprehensive survey of the various counties and cities. The study identified two options to update planning services fees to ensure continued 100% cost recovery. Those options were utilizing the Consumer Price Index, the CPI, or other regional factors to update the cost calculations established in the study on an annual basis, or to use the county's anticipated labor cost increases, such as step increases, benefit increases, and cost of living raises. As part of the 2018 update, staff recommended using changes in the calculated weighted labor rate as the basis for annual fee updates, and that was the approach that we took in 2019, and that is the approach that we are proposing this morning. Based on the changes in the calculated weighted labor rate, the department is proposing a 3.2% increase on all flat rate fees. This proposed increase translates to increases ranging from $2 to $125 per application. Some examples of those fee increases are for parcel maps without use permits, it would go up 104, agricultural use permits 107, and use permits requiring board action 125. No increase is proposed to the deposit-based fees. As in the prior item, staff is proposing a new credit card processing fee of 3.5%. The 3.5% credit card fee will again cover bank service charges and merchant charges, and the customers will retain the option to pay with cash or check. With the addition of this new fee, the department will eliminate the existing 2.5% fee charged to county departments and divisions for fees collected on their behalf by the department. This proposed new fee transfers the credit card costs to the customer. In addition to services with a fee, the department's planning division continues to offer pre-development meetings and to have planners on call for general inquiries at no cost. The goal of offering these services is to help facilitate the development process through early identification of potential issues and providing direction on the process and applications needed for development to occur. As with the building item, we provided notification of the proposed amendments to regular representatives and applicants seeking planning services. This included the Farm Bureau, and in addition, we also did the Farm Bureau and the BIA. And as with the building services fee, the BIA was the only response that we got, and they found the fees to be reasonable. Staff is recommending that the Board of Supervisors this morning conduct a public hearing to introduce and waive the first reading of an ordinance to establish a new fee and amend existing fees for planning services. And if approved, these fees will become effective September 26th. That concludes my report, and staff is available for any questions.
Thank you. Any questions or comments from the board? Seeing none, we open the public hearing. Do we have any comments from the public?
We do not.
Seeing none, we'll bring it back to the board for a motion.
Motion to approve all staff recommendations.
I'll second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
Aye.
District 5 Supervisor DeMartini.
Aye.
And District 1 Supervisor Chairwoman Olson.
Aye. Motion passes. And our last public hearing, item 7.4, public hearing to introduce and waive the first reading of an ordinance to amend existing fees and establish new fees for the Stanislaus Animal Services Agency. Annette Patton.
Good morning, Chairman Olson, Board Member C.O. Hayes, County Council, Annette Patton, Executive Director for Animal Services. I'm the last one on your list for fees, so thank you for your patience. Stanislaus Animal Services Agency administers vaccinations to pets at clinics. These are privately owned pets, and we facilitate the adoption of many pets out there. In fact, it's a very competitive field. California law allows the agency to collect fees for our services, and the board of Stanislaus Animal Services Agency has approved all these recommendations for fees before you. The board is not allowed to approve fees to be put into policy. Only the Board of Supervisors can do that. Proposed change to fees include the cat adoption fee, the adoption fees for highly adoptable critters, pets, cat carriers, dog leashes, the canine influenza vaccine, the dewormer, and the feline leukemia virus vaccine. So the first one is the cat adoption fee. Currently, all cats that are adopted from the facility are legally required to be spayed or neutered before they leave. So we're just trying to recoup our cost. Currently, the fee is $45, and you get a cat that's completely vaccinated, microchipped, spayed, and neutered out the door. When we looked at the average cost, the average amongst our comparison counties is $70. We decided we didn't want that quite of a drastic increase to the public, so the board agreed on, with conversation, at $60 as the proposed fee. Adoption fees for highly adoptable dogs. This is something Jody will tell you that I'm very passionate about and want to see come to place. So if you see that cute little dog right there, he's a French bulldog. And if you know anything about dogs, French bulldogs are highly adoptable. This is just an example. We do get them at the facility. We had one 2 months ago. Dennis Cordova and myself were the first two who wanted to wait outside overnight to get these dogs, but we were being fair during the COVID times, and whoever had the appointment is the one who got this dog. This dog will go on the market for easily $4,000 to $5,000 in the community. Somebody was allowed to adopt it from our facility for $100 because that's what the current rate is. 25 to 30% of the dogs that enter our facility at SASA are highly adoptable. And what I mean by that's very competitive. We adopt out over 3,000 pets a year, and I'm sure this morning if you would have drove by, you would have saw people camped out because we had a Lhasa Apso available for adoption this morning and a Maltese available for adoption. So what I'm looking for is to have the authority to recommend the adoption price be set at the $370 mark for those highly adoptable dogs to recoup our costs. That's just recouping our costs. That means that any dog that's highly adoptable does get spayed or neutered, vaccinated, and microchipped. Yesterday, for example, if you just were to, we're very competitive in the means that adoptions are very competitive. Our number one adopters are individuals who reside outside of Stanislaus County. We do a lot of them from the Bay Area, from up north, Tuolumne County, and up in the mountains. But people will come and wait in line for highly desirable dogs. These are puppies. These are very desirable breeds, and they will not mind paying that $370. If they do not get adopted that first day, which I am going to promise you that they will, otherwise this program will not be successful, then they just revert back to the $100, $120 on the second day available for adoption. Preventative treatments, again, we're not looking to make any type of profit. These are actually vaccines that would be offered at our clinics to pet owners, and these are the highly requested vaccines. So we're just going to offer them to the cost of the public. We just held our first vaccination clinic since COVID-19 on this past Saturday. Very successful. It was by appointment only. They were able to pay using the swipe card. It was very quick, efficient. We want to expand that vaccination clinic. It was also our first drive-through clinic. So pet owners were able to keep that 6-foot distancing by remaining in their cars with their pets. The canine influenza vaccine is not something that we offer to our pets that come to the shelter. Reason being, it's a very expensive vaccine. It's on average of $20 per vaccine, and it requires 2 dosages to become completely effective. So if you have pets at home, I would recommend you give that to the dogs. So you would have to give the dog at the shelter right at intake, and then you'd have to give it 2 weeks later to be fully functional. And we want to move animals out sooner than 2 weeks, so they wouldn't stay there for their full vaccine. Dewormer is something that we do offer, but it's being requested by the public, and the feline leukemia virus vaccine. New fee for cat carriers and dog leashes. This is a fee that we just want to offer consumers when they come in to adopt. We would highly suggest to them more than what we currently do. If they're coming in to adopt, they can just bring their own cat carrier with them, or they can bring their own dog leash with them. Because currently we provide cats in a carrier, and it's very expensive for us to buy carriers for every cat that leaves, because otherwise Fluffy's going to roam out the door or fly out the door if he doesn't go in a cat carrier. Dog leashes we provide also at no cost. So we're just looking for some opportunities to, if they don't bring a leash with them, that we'll provide very inexpensive leashes that they can purchase at our cost. Why the increased fees? Basically, we're just looking to recoup our costs. Costs associated with these services are the vaccines themselves, staffing, operations, facilities, and the utilities of SASA. Fiscal impact, our current operating budget is only $5.3 million a year. This increased revenue of the fees will only bring us $29,300. If improved, the fee increases will become effective 30 days after the adoption, and the member agencies, which is our cities, our 5 cities, will automatically become effective following the county ordinance fee schedule. Staff recommendation is to conduct the public hearing to introduce and waive the first reading of an ordinance to amend the fees and establish new fees for Stanislaus Animal Services Agency. Any questions?
Thank you. Any questions? Supervisor DiMartini.
I was just curious, do you charge a fee for credit cards?
No, we do not.
I didn't think you did, so
Not
couldn't
at this
remember.
Not at this time.
Okay, that was all I was
Other
curious
questions,
about.
Supervisor Withrow?
Annette, thank you. So the 5.3 million budget that we have, when was the last time we increased the fees, or how often do we increase the to all the participating agencies? Does that happen very often, or?
We increased our fees approximately a year and a half, but not these fees that are before you. So the CAT fee hasn't been increased in over 10 years. And the vaccines, these are brand new fees. We don't even offer that service. It's just a service as an elective service. And then the highly adoptable dog is a new fee. That fee was raised a year and a half ago, 2018.
But how many agencies other agencies are in it? I can't remember.
5
Jim probably said 5.
cities.
So do we increase? They all pay to play, right? They're all
Yes.
part of that. So do we increase what they pay very often? Does that happen?
Sure,
as a
just
budget?
because of the cost of doing business.
Right.
it
So
does.
that's just annually. You guys look at that and adjust their rates.
Mm-hmm.
Okay.
That's correct.
Okay. Very good. Thank you.
One quick process question, just out of curiosity. So the JPA already approved all the fees, as you said. Does each city have to ratify that as well, or just the county?
The fees do not, just the county.
Oh, interesting. Okay. And then, again, I'm just curious, it won't alter my decision, but have we received any feedback from private veterinarians about adding new vaccine offerings at the shelter?
Have not.
Okay, great.
I would like to ask though, because I think we're always very sensitive to, and I do participate on the JPA, and I want to recognize that Supervisor DiMartini joins us frequently. He's there pretty much every meeting with us. And we're very sensitive to what the relationship is of the services provided by the public sector versus the private sector. And we're not looking for additional services to provide that would otherwise be easily accessible or better provided by the private sector. So we do ask these same questions, and as of late, that's why I wanted to jump in here, was that we've learned that the veterinarian offices are very, very busy in our community, and it's been difficult for a lot of the vets to keep up with their work. So if you're hearing otherwise, I would like to hear that, but that's at least what's been reported to us, and that particular issue didn't appear that it would defray from their business model.
Thank
There's
you. That's
actually
very helpful to know.
a statewide shortage of veterinarians.
Oh, interesting.
And we're getting ready to hire a new veterinarian, a full-time veterinarian in September. And it's going to be difficult recruitment because there is definitely a shortage in California.
Hopefully all high school students and college students are hearing that.
Right.
Job opportunities. Supervisor Withrow.
I'm just going to reinforce what Jody said. I have a lot of clients that are veterinarians, and they are very busy. And believe me, when there's something going on at the county that they don't like, we hear from them very quickly, and we have not. So as of late, so.
Great, thank you. With that, I will open the public hearing. Is there any member of the public wishing to comment on this item? Seeing none, we'll bring it back to the board. Do we have a motion?
Okay, I'll second that.
We have a motion and a second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill. District 5 Supervisor DiMartini.
Aye.
And District 1 Supervisor Chairwoman Olson.
Aye. Motion passes. Thank you.
Thank you
So
very
Annette,
much.
about 1-year-old German Shepherds. Anything going on there?
I will look for one for you before the prices increase. In
Yes,
Yeah,
exactly.
Thank you.
That is one of the breeds we do typically have a lot of. So
Yeah.
if that's what you're interested in, we will
Yes.
hook you up.
Thank you. Thank you very much.
Thank you. All right, moving on to our discussion items. 8.1, approval to establish a business grant program to provide financial assistance to businesses in Stanislaus County impacted by the public health emergency response to COVID-19. CEO Jody Hayes, are you starting us off?
Yeah, thank you very much. My pleasure to kick off this presentation on behalf of our team that's before you today. And I'll go ahead and do some introductory comments while we bring our presentation onto the screen. So you'll recall that we came before the Board of Supervisors on June 9th with the outline for an expenditure plan for CARES Act funding. Within that outline, we had $30 million earmarked for what we call community support. And of that $30 million, half of it was dedicated to our 9 incorporated cities. So since then, we've been taking actions and following through, and you've had some items come before the board to get those funds out to cities and made available for them. We've once again received positive feedback from the cities and appreciation for doing that to support their budget process. Today we're back to discuss the other $15 million in community support funds. And I want to acknowledge up front before we get into today's presentation, because what we're doing here and probably what we've done over the last couple of weeks is a little different than how we normally program funding in Stanislaus County. I just want to acknowledge a lot of what we're going to do today is a work in progress. And in the past, I think our tradition is we want to complete a program and fully vet it before it comes before the Board of Supervisors. This program happens to have a lot of input from community members, as well as conversations with individual board members and the influence of our ad hoc committee as well. Even with all of that input, there are still some components of it that we're going to acknowledge will come back to the Board of Supervisors for further action. I think our challenge is that we all share an interest in programming these funds as quickly as possible into the community to provide economic relief in Stanislaus County, particularly for our business community, which serves as the fabric of our economic engine here. In order for us to move fast, we're going to have to go in pieces, whereas in the past we would try to go in a whole. So today you're going to see some of the core pieces of the business support program. Before the staff gets started, I do want to recognize and thank our ad hoc committee of the Board of Supervisors. They've done a lot of work in trying to support our efforts and help and guide, and that includes our chairwoman Olson as well as Supervisor Withrow. And I also want to thank our entire core team that's here today in this presentation. So we have our Workforce Development Director, Doris Foster, here, along with Senior Management Consultant, Patrick Kavanaugh, and Assistant Executive Officer, Raul Mendez. So this is the core team that has tried to pull this together, and I'm pleased to be here as early as we could to present the information and also let you know we will be back in future meetings on a pretty frequent basis, putting more and more pieces of this puzzle together. So with that, I'll go ahead and turn it over.
Great, thank you, Jody. Patrick, if you can turn the slide. Again, Chairwoman Olson, members of the board, Raul Mendez, your Assistant Executive Officer, here before you to share with you and the community our progress on this important initiative. As indicated by Jody, this is a component of the CARES Act funding, and specifically the $50 million that are specific to business and community revitalization. As mentioned in the staff report, on June 16th, the ad hoc committee held a meeting with some local community stakeholders to discuss this funding and allowable use or proposed uses of the funding going forward. Stakeholders represented the business sector, philanthropy, community-based organizations, basically individuals that made up and are providing services to our diverse community of Stanislaus County.
Raul, I'm just going to jump in right there if I could. Sorry, you just got started. I'm interrupting you here. I apologize. But this just goes back to John Mataka's comments, and it's always so frustrating when somebody says something, walks out, and doesn't wait. You know, that committee that we had, the ad hoc committee that we put together, was a very diverse committee, and it was from leaders from all across the Hispanic community. And so I just want to point that out right now to kind of correct the record of what happened earlier when he came through and said that. So sorry. Okay.
Yeah. No. Thank you, Supervisor. That's an excellent point. As you all know, I've served this community faithfully for a number of years, and there's a lot of different ways we can engage the community at different levels. So in addition to the work that was done by the ad hoc committee, I can tell you that the staff has been engaged communicating with members of our community that are serving these very same populations. So excellent point. Good to start that at the beginning there. Essentially what we have before you this morning, I think it's still morning, yes, is a proposed allocation of funding into 3 program areas. The Business Revitalization and Economic Development Support funding allocated through the CARES Act funds is an investment strategy in local businesses and nonprofit organizations intended to stabilize the small business economy and secure the ongoing operation of nonprofit services critical to community support and economic recovery in Stanislaus County. That's a very important purpose statement. And you'll see in our conversation today and going forward, everything will kind of roll back to that purpose statement. As discussed, we're essentially proposing that we allocate funding into 3 areas identified as our business grant program, which we will be spending a lot of time talking about this morning, our nonprofit support program, and our community match fund program. The last 2, we will be sharing some information and concept, and certainly have an opportunity to engage the the board, and then come back at a future date with some additional discussion based on your direction. The proposal is to allocate $10 million of the $15 million to the business grant program, $4 million to the nonprofit support, and then $1 million to community match funds. At this time, I would like to share some details and also in concept some of the elements of the 3 programs as proposed. These areas were developed, as mentioned by the supervisor, based on a lot of community input that was received from a variety of different avenues, but also building off some of the work that was done here locally, kind of on a smaller scale, local programs that were administered previously, utilizing some of these same funds directed or earmarked for COVID-19 response, and also by our nonprofit community. The business grant program will build on the small business relief program specifically, although it does offer larger grant amounts and will not cap the number of employees. Some of this was based on feedback that we received. We've made, as you will see, some accommodations to some of the feedback that was received to make it a little bit more far-reaching in terms of our business community. To be eligible, a business must be a for-profit, independently owned business in Stanislaus County. It must possess a current local or state license or permitting. It must be in operation for at least 12 months, although based on some of the feedback and direction, we have built in a component that will provide an exception to this particular eligibility criteria, but it will ask that the business submit a little bit more financial information just to ensure that it is a business that's in good standing and a viable business. The business must not have engaged in any illegal activity. And then if we can kind of pause, that last bullet point tries to outline some of the businesses that are ineligible to participate in this program as presented today. These include lending and investment institutions, insurance companies, corporate-owned national chain businesses and stores. As proposed, other elements of the program also include, it's important to pause and kind of focus on the funding structure and then what eligible expenses consist of. And so for the proposal that we have for you this morning, we are recommending that at least 50% of the funding go to those businesses that are identified as those from having 1 to 50 full-time employees. This obviously focuses on the small businesses in our community. As part of that, there's also a proposed maximum grant funding amount of $25,000 for these businesses. Medium and large businesses are eligible also for this program. Those are identified as businesses consisting of greater than 50 full-time employees. The maximum grant funding amount for this group is $50,000. That's kind of what's recommended. Funds must be used for operational needs related to, obviously, COVID-19. They include elements such as payroll, lease, mortgage payments, material supplies and services. In many cases, some of those may be related to making their facilities available and adapting their facilities to be able to operate under the guidelines that are obviously provided both by the state and here locally. Scoring criteria for the business grant program is still under development, but some of the areas that we are looking at is ensuring that we focus on prior business health, the impact that the COVID-19 has had on the business, and then any business planning impact that the business may be experiencing. The county staff will be working with the advisory group that was brought together by the ad hoc committee to finalize this criteria, and then we do intend to bring back to you at a subsequent meeting kind of our recommendation for the criteria prior to any scoring of the applications. So that's an important point to note. We're still in the process of developing that criteria. We have received a lot of good feedback. I think we're on the right path. It's just we need to fine tune the criteria just to make sure that the individuals, the businesses that are being awarded are those that are most severely impacted by the pandemic. So as mentioned, an emphasis will be placed on those that have been closed the longest, impacted the most severely. I know there was a lot of discussion this morning about personal care services. Those businesses have been impacted from day one. Many of them have remained open without any opportunity to reopen. So that certainly will be a focus as part of this criteria. We are also looking to, and again, based on some of the feedback we received, how do we reach those disadvantaged communities? So a component of the evaluation will consist of that. And then last and not least, going back to the purpose statement, businesses that present the most economic investment return to the community. That's an important component as well. So there's 3 elements there. We intend to be able to refine that as we go forward and then bring that back for formal consideration and a recommendation. As I think we all know, a critical element of any program is outreach and education, and ensuring that the individuals, the businesses that are eligible, know how to participate in the program. There was a lot of feedback provided to staff, and I know to the board directly from some of the community groups that we work with as to how we can improve on that point. So that's certainly something that we've taken very seriously. County staff has been working with the local work group. I know the Latino Emergency Group has been one entity that we've been interfacing with. I know there's been members of the community that have directly communicated, reached out to us, some of their ideas. So we'll certainly put that all those strategies together. And what we would like to do is enhance the way we businesses participate on a countywide basis. So the county is interested in entering into agreements with community-based organizations for navigation services. These navigators will be educated on the grant program, trained on how to use the grant application website. With this knowledge, they'll be positioned to effectively assist businesses, particularly in disadvantaged areas, with compiling the necessary financial information, completing the application, and accessing and using the grant website. That's a very important element of this program that we present to you this morning. A comprehensive outreach strategy has already been developed based on some of the community input received, and that strategy includes the use of social media to a greater degree than it was previously in some of our other programs, the creation of a dedicated website, email contact, video, webinars, print media, a grassroots effort, paid advertisement, really trying to get the message out that this program is available and how you go about applying for the program, again, if you're eligible. Assistance will be provided to those businesses that may not have the resources to pursue the grant application process. I know with our small business relief program, because it was such a small window, it was limited in terms of what we can do in this area. So the plan here is to spend a little bit more time with the time to ensure that the outreach is effective and that the navigation services are provided so that, again, businesses that are eligible are effectively able to apply and be considered for this funding. I'm going to pause there. A lot of information regarding the business program. But I do now want to kind of transition to the other 2 program areas that we'll be talking about this morning. As you all know, nonprofit organizations play a critical role in the fabric of our community, including the direct service providers working in our community to fill many service gaps. The county has a longstanding tradition of working with our local nonprofit groups. That will continue, even more important now maybe than ever, to ensure that we're interfacing, communicating, discussing with them, and have kind of a uniform strategy in our approach to addressing this pandemic as a community. The community also has groups that we rely on for arts, culture, and recreation. So that's something that's important to point out as well. In addition to the traditional service providers that are providing the direct services, we do also have members of our nonprofit community that engage our community in kind of the more non-traditional, the arts, culture, and recreation. Although we're not far enough advanced this morning to bring forth a specific recommendation as to how we will work with these groups, we have prepared some slides that can help at least have this conversation today, with the hope of, again, bringing something back to you that's a little bit more solidified and something that you can take action on. So in concept, what we're proposing is that $4 million be allocated for nonprofit support. The way we are proposing that we do this, $2 million will be for direct service providers to assist with the COVID emergency response. That includes public information campaigns, care and shelter support, networking, and communications with the hard-reached populations. While we have implemented many strategies to try and engage this section of our sector of our community, we understand we can certainly do more. This concept would be focused on leveraging our existing relationships in our communities to improve our emergency response, while also helping many of these same organizations become stable and be able to address some of their issues and needs as well. The next section pertains to $1 million for youth services and activities. This would include organizations proposing direct services to our youth, and also support for community sports and recreation programs that we know have been severely impacted over the course of the last several months. And then the final $1 million would be for community-centered arts and cultural programming. Much of what defines us as a community is found in cultural arts programs, all of which have suffered under the conditions of the pandemic. While most of our efforts have been focused on core issues necessary to respond to the immediate threats of public health, we also recognize the important role arts and culture play in the identity of our community. And so that's an important piece we want to emphasize. So in summary, we need all the partners to help us respond to the emergency and recover as a community. We look forward to returning back to the Board of Supervisors with a more detailed plan for nonprofit organizations in the next few weeks. I know we've been in constant conversation with our nonprofit leaders. There's a lot of great feedback that they provided to us. There's ideas that they've suggested. We like to package all that information and bring it back to you formally at the next opportunity. The last program area, is in the area of a community match fund. This is maybe a more creative approach to try and really stimulate our local economy. And so staff is proposing that we allocate $1 million for this area. What it would consist of is a touchless gift card program, modeled or I guess taken from some of the work that's been done here locally in the city of Modesto with a smaller scale program. But essentially, we would provide match funds to double consumer spending here locally. Under this program, consumers would be able to purchase gift cards in different denominations: $25, $50, $100. And with the match fund, we would be able to double those amounts, so the value of those cards. The purpose would be that then the consumer would spend those dollars here locally, stimulating our local economy. Now, how this is different from the Modesto program is obviously this would be implemented on a countywide basis. There are still some elements of the program that we need to research and ensure that we can implement the various activities associated with the program, but certainly it's something that we would want to bring back to you in kind of more final form. The gift cards would be good at multiple merchants and not limited to a single restaurant or merchant. In concept, you can certainly use a portion of your cards here in this community or another community in Stanislaus County, whether it's a city or an unincorporated town. So again, the goal is to bring this back for you for further consideration at a future meeting. So in closing, the 4 staff recommendations that we have before you, The number one is to approve, request or recommend that you approve the establishment of the business grant program to provide financial assistance to Stanislaus County businesses impacted by the public health emergency response to COVID-19 through the allocation of $10 million of CARES Act CRF funds. Staff recommendation number two, authorize the CEO or his designee to initiate the application process for the business grant program. Staff recommendation three, direct the CEO or designee to return to the board with grant application scoring criteria for the business grant program. And then the final recommendation is direct the CEO or designee to return to the board with plans to initiate the two program areas that are not quite ready for you to take action on today, the nonprofit support program and the community match fund. That concludes staff's presentation. Obviously, we're available to answer questions, and thank you.
Okay, thank you so much. Questions or comments from the board?
No comments, but I'll wait until see if there's any questions.
Supervisor
Yes,
DiMartini.
I think, once this program is refined a little bit, that it'll be good for the county. There are some businesses that have been really severely impacted, and you've mentioned them briefly, the nail salons and barber shops. They've been shut down by the government. I think unjustly, but there's some of them that haven't operated in about 4 months. So these certainly, I think the more that you're impacted by this coronavirus, your higher the score should be. I hope this, works out better than the last time where businesses were scored and then the numbers of the score were completely disregarded, and there was awards made to businesses that were not even impacted by the coronavirus. So I don't want to see that happen this time. We definitely have businesses within this county that have been severely impacted. So those are the ones that I like to see helped, and not the ones that put in a phony application like the last time and received money that I felt they weren't entitled to.
Thank you, Supervisor. Other comments or questions? Okay. Supervisor Berryhill did have one comment. Supervisor Berryhill says, I fully support the CARES program for small businesses, especially now with the new restrictions and closures put forth by the governor. Thank you to the entire county staff for implementing this program so quickly if it's approved. That's from Supervisor Berryhill. And we will now go out for public comment. Any members of the public wishing to comment on this item? Seeing none, we did receive, just a reminder, we did receive some public comments by email for this item. So I'll direct the board to comments from Mike Garcia with the American GI Forum, as well as to Noe Paramo from the California Rural Legal Assistance Fund. With that, I'll bring it back to the board for further comments or discussion.
I just want to.
And I'm sorry, also from Miguel Donoso.
Yeah, I just want to say we've gotten a few emails from Mike Garcia, and maybe it'd be a good idea to get him to come sit down and sit down with us and have a little conversation about what we're doing. And I don't know if anybody has reached out and talked to him anymore, but anyway, Jody, just an idea, one of those ones where maybe we get him in here, because he seems to have a lot of concerns that I think are unfounded at this point. There's a lot of stuff we're doing that he just needs to be made aware of if he's not.
That's a good suggestion. I'll turn it over to CEO Hayes to speak to his discussions with Mr. Garcia, but I also wanted to let the board know that I did respond to Mr. Garcia via a letter. But I think that's a really good suggestion to bring him in for an actual meeting. CEO Hayes?
Yeah, thank you. And we can definitely invite some of the community members who have provided multiple public comments on expenditures of CARES Act funding to meet with us in person. However, I will let you know that we have tried to reach out and engage in dialogue on a frequent basis, as frequently as we can. I want to acknowledge, that there are a lot of dynamics at play here. The scenario is moving very quickly, so we do try to loop out with not just the individuals who are providing public comment here, but a lot of other community members, representative of a variety of constituencies within Stanislaus County, particularly to Mr. Garcia. I will let you know that I have spent some time with him. I think he has a lot of valuable insight for us, and we appreciate his comments. I have also established a link directly into our office, recognizing that I cannot personally spend as much time with every single one of those individuals who wants to engage in the conversation. So I have identified one of our senior management consultants that is doing this on a full-time basis at this point, that's available to support and to talk through issues and so forth. That's Miss Erica Ignacio in our department. I also did conduct the unfortunate Zoom meeting. So those are the meetings where we have to get on video with everyone. I did conduct a Zoom meeting with a variety of community members, including Mr. Garcia, to invite them in to have the conversation so that although we couldn't all be in the same room together, we could at least be on the same screen together. So we're making those attempts. We will also share out our work as we move along here. And I will tell you that much of the recommendations that were received, they don't all align, so the different folks have different recommendations. But I think the core essence of what's being requested here, I think many of the constituents are going to be very pleased with how we move forward here in the coming weeks.
Perfect. Thanks, Jody. I just wanted just for you to make that statement because we get these things and we are all over this. So I just want to, it's good you point that out. Thank you.
Supervisor Chiesa.
Thank you very much, Madam Chairperson. First of all, thank you for doing this so quickly. I think that there are a few instances when government moves really quickly, and this would be one of them. We were able to put a program together pretty quickly last time. Now we're trying to improve that a little bit slower. The outreach plan that you shared with us, that's not a public document at this point, I don't think, but it was one of the most comprehensive that I've seen, trying to get into areas that might be disadvantaged in this process. We know when we were talking about the PPP program, people who had relationships with banks and attorneys and accountants were able to get that federal money quicker. And I like the process in which we're going through right now and talking about navigators and getting people in the community to help fill out the application. So thank you for that. And I want everyone to know that I'm going to vote for this today. There's no problem. I just want to tell you what would be ideal. I know I've made these comments, but I think I need to make them publicly. The business group got together with the chairwoman and Supervisor Withrow. They had a lot of good insight that I wasn't a party to, so that's why I'm going to vote for it. I like the collaborative process that they came out of. To me personally, I would prefer much more of a statement on the 1 to 25 employees. I think they've been adversely impacted more than the larger business in general. And we're doing at least 50%, I know that, but I would have made it, I think we're about 90% in the last program, ended up in that category. I would have raised it. I think that's more impactful. The 25,000, the 50,000, I think are too high. We're trying to really get people through the COVID crisis, which now is in its 4th month. And if we're allowing the same eligible people, because we haven't said if we're going to allow people to reapply, I mean, it's a part of it, right? If we do allow, then really rent and utilities, and I know you can pay employees, but most of the employees had the opportunity, if they were a closed business, as Supervisor DeMartini was talking about, they had the opportunity now to have gone on unemployment. So I think your true costs are mostly with the paying rent and or lease payments and utilities, the base cost. So I think we're going to find that a lot of people, now that this is extended, we're going to be overrun. And we were very fortunate last time we were able to award everyone that put in an application. I don't think we're going to be nearly that lucky this time. I like the nonprofits, the direct service people, especially because right now they're going to provide something in the community and the potential for that. I love that we're helping the youth who have been severely impacted in all of this. And the community match component, I think is great. I just want to make sure, and I know I've had discussions with the CEO, that this is countywide. Modesto definitely has an advantage right now the way this was configured. I say that. It'll take a lot of outreach, the same type of outreach that we're going to do in the disadvantaged areas. So again, I'm going to vote for this. I want to thank you too for doing all that work. The business folks, I think there were 20 or 15 or so on there, for their time and input into this to make it a really good program. And it's still improving as we go along. So.
Okay, just a few comments. I also want to thank, as others have, the members of the ad hoc committee. It was a really diverse, geographically, ethnically, industry-wise representation from across our county of business and nonprofit leaders who helped put this plan together, and we're really grateful for the time they spent with us, emailing their ideas, texting, calling their ideas, and also in a meeting, brainstorming on how we can best help our communities not just survive this time, but ultimately begin to thrive economically again. So thank you to those of you who helped with that effort. Also wanted to thank staff, particularly Raul, Patrick, Doris, Jody, Patrice, others who were involved in building this plan, organizing it, putting it together. The outreach plan in particular, as was mentioned, is fantastic. So thank you for the amount of time that you've invested in that to make sure that it's comprehensive, robust, and really targets the need where it is greatest. So thank you for that. I'm particularly excited about the touchless gift card program. I think it's a really creative way to help both small businesses and consumers by leveraging funds. So I'm confident that it can be expanded countywide, and I just think it's a really creative, unique, long-lasting way to really help a whole lot of businesses, particularly in the restaurant and retail space across the county. I agree, Supervisor DiMartini, with your comment that the higher the COVID impact, the higher their score should be for receiving this assistance, and we have designed the program accordingly. So I have no doubt that that will work effectively. So again, thank you to everybody who's been involved in putting this together, and I will be eager to support it today and move these expenditures, or no, not expenditures, move this revenue out into the community where it can do a lot of good. Any other final comments or a motion? Supervisor Withrow.
If I could just really quick, first, same thing. Thank everybody for all our hard work on this. I know we came together quickly, and thank the people that participated in the meeting and have provided us with a lot of input on all of this. Doris, Patrick, Raul, thank you guys for everything you're doing, and Jody to make this work, and Kristen for being a part of this. The outreach is the key to this. I think it's so important, as we've talked about here, just to get that outreach. And I think the community-based organizations to help navigate that, I think, is a great idea. It's great that we're going to have them, not only for this program, but I envision them being able to help as the PPP has been extended, that they're going to help businesses with that part too, not only our grant here, but they'll be able to inform and help them with that as we talk about the less sophisticated businesses are the ones that have not been able to take advantage of these things. And I see this being totally different on this one and really being able to make a difference. So I thought I read somewhere, I keep going through this now, that by the end of this month, the application process period was going to open up at the end of this month. Is that right? Did I read that somewhere? Maybe it was something else.
Yeah, our goal is to get the application process open as quickly as we can.
Okay.
Now, with that, we need to have that robust outreach program in place, along with some navigation services and so forth. So our goal is to get it open quickly, and we're looking for an open period of about 3 to 4 weeks.
Okay.
That then allows us the time to retool the scoring criteria, the award process, come back to this board while we get the application process opened.
Perfect. So I think that's, not that we need, one more thing to do, but anything we can do to just expedite this as we have up to this point, just continue that movement to get these funds deployed out in the community just as soon as possible. And like I said, I know everybody's swamped, and I appreciate everybody's workload. So, but I think this is critical too, especially in light of what's happened as of yesterday with another shutdown. That we've just got to get these funds out there as quick as possible. So anyway, just very proud of all the work that all of you have done to put this together, and I really think it's going to make a difference in our county here. So thank you all, and with that, I'll make a motion that we approve all staff recommendations.
Thank you, Supervisor. And I believe Supervisor Chiesa, did you have additional comments?
Oh, to pass.
Okay, we have a motion.
Second.
And we have a second. County Clerk, will you please call the roll?
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
Aye.
District 5 Supervisor DiMartini.
Aye.
And District 1 Supervisor Chairwoman Olson.
Aye. Motion passes.
Thank you.
Thank you so much. And our final item on today's agenda, item 8.2, acceptance of an update on emergency non-congregate sheltering provided during COVID-19 public health emergency and authorization for the Director of the Community Services Agency to enter into agreements to secure sites and services in support of emergency non-congregate shelter options. Kathy Harwell and Tina Rochak. Good morning.
Good morning. It is still morning.
It is.
Good morning, Chairman Olson, members of the board, CEO Hayes, County Council Bowes, and members of the public. Thank you for what you're doing for all of us during this emergency. Today we're providing an update on the emergency non-congregate sheltering services provided to date as a result of the COVID-19 public health emergency. We will also be seeking your approval to enter into agreements to continue to secure sites and services in support of the emergency non-congregate shelter options through September 30th, 2020. I'm Kathy Harwell, the Director of the Community Services Agency, and also responsible for Care and Shelter branch of the EOC operations in this time of emergency. I'm joined today by Tina Rocha, Deputy Executive Officer and Interim Assistant Director of the Community Services Housing and Homeless Services Division. I'd like to recognize Tina for joining our agency during this really tough time and leading our current efforts on housing and homeless services. I'd like to begin by sharing a brief background on this project, and I won't go through these slides. As you are all aware, the actions taken by the federal and state level in March set forward our course of action related to the COVID-19 emergency. Most importantly, a local action that was taken on April 2nd, 2020, set our course forward related to emergency non-congregate sheltering. On April 2nd, Stanislaus County Public Health Officers submitted a letter to the Stanislaus County EOC urging that emergency non-congregate shelters be identified to reduce the transmission on COVID-19 for the following populations. First, those requiring emergency isolation and quarantine, individuals who are COVID positive and need isolation or quarantine, and individuals who have been exposed to someone COVID positive, as documented by a public health official or medical health professionals. Second, those individuals who are asymptomatic but are at high risk in our community, individuals over 65 or individuals who have certain health conditions living in congregate shelters and requiring emergency non-congregate living setting to help ensure social distancing and limit their exposure and transmission. On April 21st, this board ratified the emergency occupancy agreement with the owners of the Modesto Hotel and appropriated up to $2.7 million for emergency non-congregate shelter for the at-risk and COVID-related individuals. And on June 23rd, this board accepted an update on the emergency non-congregate sheltering and support and authorized the Auditor Controller to carry forward fiscal year 2019-2020 unexpended and unencumbered balances to fiscal year 2021 legal budget. I'll give you a little background related to FEMA. On March 27th, 2020, FEMA approved the state of California's request for reimbursement costs incurred related to emergency non-congregate sheltering at the local level. This is the first time FEMA's ever made that action. On July 1st, 2020, FEMA approved another extension through July 30th, 2020. As stated earlier, the county entered into an agreement with the owners of the Modesto Hotel. The arrangement provided the county with control of the entire hotel facility, including the use of up to 121 rooms. The contract included a 30-day termination notice. On April 21st, 2020, the first cohort of guests identified to be over the age of 65 or with certain underlying health conditions were relocated to the Modesto Hotel from existing local shelters. Again, here's a picture of the Modesto Hotel and a map that shows where the hotel is located. As a reminder, this site provides 24/7 operations, including meals, health checks, linen and housekeeping services, and site security. Modesto Gospel Mission, Stanco, and Salvation Army have been critical partners in this project. Staffing for this site includes 7 days a week, shelter manager, an overnight manager, shelter administrator, public health nurses, adult protective social worker, mental health case managers, and support staff and delivery drivers. I'd like to recognize the following county departments who've supported and staffed these critical functions since the day that we opened the Modesto Hotel: the Community Services Agency, Health Services Agency, Behavioral Health and Recovery Services, Probation, the Library, and the Clerk Recorder's Office. Without all of them, we could not do this. I'd like to share a little demographic information with you about the residents that have been at the Modesto Hotel. As of July 7th, 2020, we've served 158 guests. As you can see, the majority of these guests have been 51 years of age or older. However, we've had some guests younger than 50 who have had medical conditions that require emergency non-congregate living arrangements. The emergency non-congregate shelter's primary purpose, again, is to provide non-congregate shelter to those most in danger related to exposure to COVID-19, those over 65 years or older, and individuals with compromised health. There's been several health conditions of the guests at the Modesto Hotel, and these include 30% with asthma, 24% with heart or circulatory conditions, 8% with diabetes, 6% with infectious diseases, 6% with central nervous system, and 5% with musculoskeletal problems. And several of the individuals have multiple health complications. 41% of our guests have also disclosed that they have mental health conditions. 11 of our guests have had a caregiver who provides assistance for their daily living functions. And unfortunately, 6 guests have passed away from serious health conditions since they've been at the Modesto Hotel with us. No guests have contracted COVID-19 at this site. On July 7th, 2020, there were 108 guests at the Modesto Hotel. This is assisting with the decompressing of the population at our local shelters. The makeup of our guests on July 7th were 29 guests from the Access Center Emergency Low Barrier Shelter, 32 guests from the Salvation Army Bavarian Shelter, 20 guests from the Modesto Gospel Mission, 5 guests from the Turlock Gospel Mission, 1 guest from We Care and Turlock, and 21 guests that have been referred through the care team, public health, and local hospitals. Overall decompression rate for our local shelters is 14.6%, thereby providing additional space for social distancing at each site. We continue to work closely with the local shelters to assess their needs and to support safe conditions for those remaining in congregate living. CSA hosts a weekly meeting with local shelters to assess their staffing needs and their needs for supplies. We continue to focus on long-term housing strategies, especially as it relates to transitioning our most vulnerable population into permanent housing solutions. In December 2019, our California governor announced the 100-day challenge. In February 2020, Stanislaus County was notified that we were one of 4 counties selected to participate in this first cohort. For the period of May 27 through September 2020 is our challenge period. Our goal in 100 days to serve 100 individuals experiencing homelessness in the at-risk population will successfully exit into safe and stable housing, which can include permanent supportive housing, landlord engagement units with a focus on veterans, individuals dealing with severe mental illness and/or substance abuse order, and individuals with disabilities. To date, 20 individuals have been referred from the Modesto Hotel to Kansas House and will be transitioning when Kansas House is available to take those residents. Our housing assessment team, located at the Access Center and contracted with the Turning Point Community Programs, continues to work with the remaining guests at the Modesto Hotel to secure housing options for them. On April 6, 2020, we also began utilizing local hotels to house individuals and families required to self-isolate or quarantine to begin due to exposure to or being tested positive for COVID-19 who did not have a safe place to stay. Referrals for these services are received through public health and local hospitals. The shelter period can be as long as 14 days and on a couple of occasions has been longer than 14 days. As of July 7th, 2020, 44 individuals have been sheltered for a cumulative total of 451 shelter days. During this period, the care team also provides food and supplies to those sheltered under this program. So here's a few demographics on this program. In addition to the emergency non-congregate shelter, we also receive referrals from public health to support families and individuals required to self-isolate or quarantine in their own homes. So not only do we help support individuals in emergency non-congregate shelter settings, we also support individuals in their homes. These referrals come through public health and through the 211 call center. As of July 7th, we've received 553 referrals. I wanted to share a little bit about those referrals. The primary items of need are food, cleaning supplies, personal hygiene supplies, baby items, and prescription medication. CSA employees secure the needed supplies and deliver the needed food and supplies to the homes. Out of the 553 referrals that we've received through the call center 211 or through public health, only 45 individuals have stated that they did not have a need for services. On April 21st, 2020, this board approved appropriations of $2.7 million for emergency non-congregate shelter and services. As of June 30th of 2020, a total of $1.2 million has been expended. The budget before you today provides emergency non-congregate housing through September 30th of 2020. The estimate includes 3 full months of occupancy at the Modesto Hotel with a minimum of 80 rooms, as well as funding for hotel rooms for those required to self-isolate or quarantine at the direction of public health and our local hospitals. These costs continue to be eligible for FEMA reimbursement through July 30th and other reimbursements, and we're continuing to work with FEMA and hope that that extension will go beyond July 30th. In order to support the cost for these services, we have successfully secured $750,000 from the state of California through Project Roomkey and $10,000 through the Emergency Food and Shelter Program. Reimbursement opportunities continue to be available through FEMA at 75%, as I stated, through July 30th, and we will continue to work with the state of California for additional extensions. Remaining revenue support for this request is available through the Coronavirus Relief Fund through the CARES Act. There is no general fund impact for this request. So, summary of our recommendations. Today we're asking for you to accept an update on the emergency non-congregate sheltering and support provided through the COVID-19 public health emergency. Second, we're asking you to authorize the director of the Community Services Agency or her designee to negotiate and enter into any agreements through September 30th, 2020, in an amount of up to $1.2 million to secure sites and services to reduce the transmission of COVID-19. And lastly, we're asking you to authorize the auditor-controller to make the necessary budget adjustments, increasing appropriations in the Community Services Agency Housing and Homeless Services budget by $1.2 million, as detailed in the attached budget journal. So with that, I'll open it up to any questions that you may have.
Thank you. Bring it back to the board. Any questions or comments? All right,
I'll just go
Supervisor
ahead and make
DiMartini.
a comment because I have a little bit of an issue with this. You know, I can see the point of maybe putting somebody who's tested positive in one of these hotel rooms, but the just an endless amount of money thrown away on homeless programs. It just in the millions of dollars on this. We just last year or so we put in a multi-million-dollar homeless shelter, and then paid the Salvation Army $3 million to run it, and then taking the people out of it, what you call decompressing, which is a good government term, and then putting them in the hotels. So after we spent these $5 million between running the shelter and building it, it was more than that. So, and then I want to remind everybody that in addition to all this money that we spent, we got $900,000 in the contingency, restoration contingency for the anticipated damage to the hotel rooms that these homeless people are going to cause. I just want to remind everybody about that. I might be able to support this, but I really think at some point we just got to quit, throwing away millions of dollars more on everything that really sounds good, especially after we spent all this money building the homeless shelter.
CEO Hayes.
Thank you, Supervisor DiMartini. I would like to just provide brief comment, and I would note that our intent is to only operate this program as long as necessary, given the conditions that we're facing in the community. It's very unfortunate that we're not coming before you to just describe the closure of the program, which was actually our original intent. At my direction, staff did provide a termination notice to the hotel probably a month ago or so, with our expectation that we would be able to ramp down. The conditions in the community, as we've discussed significantly today, do not warrant us going that direction. I share that example with you. I just want you to know that when we can return to our normal service platform, we certainly will. This program has served a whole lot of people, and I appreciate Kathy and Tina putting together the presentation that we saw today and what is a pretty complicated agenda item. It requires a significant lift of resources to be able to support that population off-site. And the concept is quite clear. Those individuals are at extreme risk for hospitalization should they catch COVID-19. So we are pleased that we've kept them out of the hospital, the majority of them. And I do want you to know that when we can make a change, we will certainly move forward and make a change. Thank you.
Thank you, CEO. I had just one question. I noticed on one of the slides when you were talking about the various illnesses that the people at the Modesto Hotel have suffered from, that 6 of them unfortunately passed away. And I was just curious, I don't know if you have this information on hand, but is that a similar, I found that to be startling, is that a similar ratio that we often see in our other shelters, including the shelters that these people moved from?
I don't have statistics on the rates of death that shelters have experienced, but we do know that it is consistent that there are significant health conditions in the individuals that are in our homeless population, especially as they're aging. These individuals that we've had, and that's why the vulnerability to move them from congregate shelters to non-congregate sheltering options is to reduce their exposure and to reduce that propensity for them then to enter into the hospitals and need even more extensive care. We know as we receive these individuals into the Modesto Hotel, we have public health nurses there to help support their care. We had an individual who came in that was already in stage 4 cancer in a hospice, had been in the shelter and transitioned to the Modesto to the Modesto Hotel, where she actually was able to really die with dignity in a very safe place. And we've had individuals that have had heart attacks and cardiovascular conditions that have been transferred back and forth from the Modesto Hotel over to Stanford and back. So the care that they're receiving there and the support has really helped to increase their their life, their opportunities for health care. But the individuals that we've received, those 6 had significant health problems.
Okay, thank you for that greater explanation. It's helpful. I just wanted to make sure, and I didn't think there would be, but I wanted to make sure there was nothing unique to the operation of the Modesto Hotel that's causing people to get ill or pass away.
I think the uniqueness is that the individuals are the ones that have health conditions, right?
Yeah.
And I do want to make a point about the decompression on the shelters. There was an outbreak of COVID-19 at the Modesto Gospel Mission. And so the individuals that we had already had at Modesto Hotel would have been
We're safe from that.
Yes, they were safe from that outbreak.
Thank you. Okay, Supervisor Withrow.
I appreciate Jim's pain with this stuff. I know that this is tough for you to swallow these things, Jim. We all very much appreciate your input on all this stuff. I think it's great that we have, excuse me, the ability to the 30-day out on these things. We can get, sounds like I didn't realize that we had actually pulled the trigger on that at one point, and we're able to, so that just gives that the option to shut this thing down as soon as we feel like it's not needed anymore. So Kathy, Tina, thank you guys so much for doing this. The fact that we haven't, I'm always amazed, but I think maybe it's partially because of, or maybe a good chunk because of what we've been doing in this community, that we haven't had a giant outbreak at one of our homeless shelters is amazing. I know the Gospel Mission has had, but that's been under control. But I think because of the fact that we have this in place has helped with that we can put these people, and that one slide you had back there a ways back here, that was the 440 cumulative days, I guess, slide, I thought was telling. That just really shows these are how many days we've been able to isolate people, keep them out of the general population, and these people are all the ones that we really should be concerned about. It's the older population. If you looked on that chart, the amount that were how old they were, the majority of these people, and the very vulnerable with weak immune systems and things like that. I think it's a testament that good thing we had this and still have this in place as long as we need this to keep these people out of our hospitals and to help them to be able to avoid, because they are the most vulnerable. They are the ones that we really should, if it was up to me, we would totally focus just on the older people, let everybody else go back to their lives, and just work on the people that are old and vulnerable. And so anyway, this is a good thing. Like I said, Jim, I appreciate very much your input and your thoughts on it too. And we will shut this thing down as soon as we can and move on. So thank you guys for this.
Thank you. I don't think I went out to the public yet, did I?
No.
Okay. Is there any member of the public wishing to comment on this item? Seeing none, and I don't believe we've received any email correspondence.
That's correct.
Okay, then I will bring it back to the board for a motion.
I'll make a motion
We have a motion from Supervisor Berryhill and a second from Supervisor Withrow. County Clerk, please call the roll.
District 2 Supervisor Chiesa.
Aye.
District 3 Supervisor Withrow.
Aye.
District 4 Supervisor Berryhill.
Aye.
District 5 Supervisor DeMartini.
Aye.
District 1 Supervisor Chairwoman Olson.
Aye. Motion passes. Thank you, Kathy and Tina. And we will move on to correspondence. County Clerk Liz King.
This board has received worker adjustment and retraining notification letters regarding the furlough or temporary layoff of employees from the San Francisco Opera and the Golden Valley Health Centers.
Refer to the Department of Workforce Development.
This board has received a copy of the Gallo Center for the Arts budget for fiscal year 2020-2021, including leases, prices, concessions, fees, and the schedule for the 2020-2021 season.
Refer to the Chief Executive Officer.
This board has received a notice from the El Solio Water District regarding the appointment of Kevin Donlon to their board of directors.
Acknowledge receipt of notice.
This board has received a letter from the Ceres Fire Protection District regarding the resignation of Jerry Hancock from their board of directors.
Refer to the Clerk Recorder and Registrar of Voters.
This board has received a notice from the State Department of Transportation regarding the notice of availability of the draft initial study mitigated negative declaration for the metal beam guardrail upgrade project.
Refer to the Department of Public Works.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Any Board of Supervisor reports this morning? Supervisor
I have some,
DeMartini.
Chairwoman Olson. I have two of them there. First, I'd like to respond to John Mataka. Fortunately, he left before the meeting ended. But he mentioned who was going to provide face masks for farm workers. And the answer to that is the Agricultural Commissioner, Milton O'Hare, and his staff has already distributed 235,000 face masks already. So apparently a lot of people don't know that, and I don't fault Mr. Mataka for not knowing that, but I wanted to bring that up. I have gotten calls from farmers about this, and I have referred them to the Ag Commissioner's office. Also, in a recent communication with Milton O'Hare, he said he just received 100,000 N95 respirators too. As far as I know, all these products are given away to anybody who could demonstrate a need. So we've already given out 235,000 masks. It shows a commitment on the county to provide the protection for farm workers. I just wanted to be sure everyone was aware of that. The other thing I'd just like to briefly mention that we just proclaimed July Parks and Recreation Month in Stanislaus County. We have some great parks in this county, so I hope everybody can take advantage of them. This is in the staff report. It says we have 5 regional parks, 12 neighborhood parks, 10 community parks, 2 off-highway vehicle parks, and then we have fishing access too. We have one just outside of Patterson, which is quite nice. So the Stanislaus County has always had a pretty good park system, and the parks are very well maintained. I would just hope that people take advantage of them and use them.
Thank you. Supervisor Chiesa.
Thank you. I'm glad that you brought that up, Supervisor. That was one of my points. I just wanted to remind everyone that this COVID pandemic has absolutely dominated the time of the CEO. We saw Kathy Harwell, director, Raul, the assistant, Patrice, everyone. So time, has value to it. And you're completely immersed all the time, and to some degree the same with our chairwoman, who spent a lot of time. You guys should probably be on FEMA's payroll in some way, shape, or form. But I need to remind everyone that animals keep coming into the shelter, and roads are getting paved, and the 911 operators are still answering the phone, and deputies are still showing up. And I appreciate from Deputy Grogan in the back all the essential workers in the county. But this morning, it reminded me, as we were spraying ourselves, producing, I saw peaches in bins on the way in. So people are harvesting those crops. And then I drove by Del Monte, and people are packing those crops. And those are essential workers too. And I was thankful as I'm driving in here, thinking about all these people during this pandemic who are still out there doing their job. And then the masks become an important component. The Ag Commissioner, what you were talking about, that they're distributing these masks so that they have the same opportunity to be safe as everyone else, the essential ag worker. So just a big thanks to everyone, all the essential workers, not only county, the obvious ones, the healthcare workers, people that are on the front lines, but also those people that are working out in the fields.
Thank you. Supervisor Withrow.
Just real quick, I got to, for the first time, and probably the last, do the update for the county at our regarding COVID. And anyway, I appreciate that opportunity. And like I said, boy, you can't look at those comments. Those are just brutal as you sit there. It was just like I sat there and read that last night before I went to bed, and you see all the things that people say. It's rough. So anyway, I appreciate the opportunity to do that. There will be City of Modesto City Council has a vote tonight regarding urban limit line, and it has to do with Wood Colony, the never-ending battle of Wood Colony, my district. And I just want to express I appreciate the input that we've received from the county, our county council, LAFCO, and our CEO, expressing our concerns, the county's concerns with this urban limit line, and as far as the really the legality of it to some extent. And so the city council has a very important vote to make tonight, and I hope that they will all make the wise and correct vote. And so I just want to make sure the public's aware of that and how much the county has been involved in that, in at least in addressing what they're attempting to do tonight with a vote to put this on the ballot. So just make sure everybody knows and pay attention and watch the city council meeting tonight. Thank you.
Thank you, Supervisor. CEO Hayes, any legislative fiscal and management report?
Just a quick note. Luckily, the legislature's not too active at the moment, so that's a good thing because we got a lot going on. However, I do want to thank Supervisor T. Martini for mentioning the work of the Agricultural Commissioner to support farm workers in our community is very important. And the comments earlier were a mental note to me that we haven't gotten that message out to the public. So a lot of that's happening and the public may not be aware. So we'll work on that along with our other messaging campaigns. But I also want to thank you for mentioning parks and the importance of parks. They are a jewel here in our local community. And although this is not a good time for distant travel and vacations like that, we do have our own assets here, and I look very much forward to try to enjoying those at some point soon.
Thank you.
Maybe tomorrow.
And with that, before we adjourn, we'll go to County Counsel Tom Bowes to talk about today's closed session.
Yes, we have. Yes, we have closed session this afternoon. We have a conference with Director of Emergency Services, Threat to Public Services, pursuant to Government Code Section 54957, Subdivision A. The board will confer with the Director of Emergency Services and County Council regarding matters posing a threat to essential public services and the public's right of access to public services or facilities. We also have a conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9, Subdivision D1. We have one case there. It's In Re Purdue Pharma et al., United States Bankruptcy Court, Southern District of New York, case number 1923649. We also have a conference with legal counsel on anticipated litigation pursuant to Government Code Section 54956.9, Subdivision D4, and we have 3 matters there. It's appropriate.
Great, thank you. Are there any members of the public wishing to comment on any closed session items? Seeing none, we will adjourn this meeting to closed session.